So I'd like to call the regular meeting of the Cumberland School Committee to order at 7:07 on Thursday, February 11th, 2021. In accordance with Governor Ramonda's Executive Order 21-10 dated February 3rd, 2021, the Cumberland School Committee intends to conduct this meeting remotely. The public can participate in this meeting remotely, but not in person by calling 1-312-626-6799 with the ID 917-6820-2114, or they can join via Zoom. And the Zoom link is on the Cumberland Schools District events calendar on the website. The next item on the agenda is the Pledge of Allegiance. So I pledge allegiance
to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
The next item on the agenda is approval of the agenda. And item A, in compliance with Governor's Executive Order 21-10 dated February 3rd, 2021, a discussion or vote on whether there is public access to the meeting through adequate alternative means. And I do see 143 participants so far, 144. Mr. Chandler, do we have public access?
Yes, we do.
Okay, thank you. So I need a motion to approve the agenda.
I will motion to approve the agenda.
Motion by Ms. Smith and seconded by
Mr. DeMonica.
Mr. DeMonica. All in favor?
Aye.
Aye. Aye. The ayes have it 7-0. Next item on the agenda is the consent agenda. I will take item A through F together. So item A, approval of minutes from regular meeting 1/28/2021 in the budget workshop on 2/1/2021. Item B, approval of minutes from the executive session 1/28/2021. Item C, the enrollment report 2/1/2021. Item D, school police report 1/1/2021. Item E, school bus inspection report 2/1/2021. And F, residency/truancy report 2/1/2021. If I could get a motion to approve items A through G on the consent agenda.
Make a motion, we approve.
Motion by Mr. DeMonica.
Second
by Mrs. Feather. All in favor?
Aye.
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 Aye. The ayes have it 7-0. And then the personnel actions, I just wanted to read those and then we can approve those. So we have 3 retirements upcoming. Linda Luzier, Building Secretary at Community School, will be retiring on July 12th, 2021 after 26 years of service. Cynthia Otis, Building Secretary at CHS, will retire on March 5th, 2021 after 18 years of service. And Mary Lynn Miller, Special Educator at BF Norton, will retire on June 30th, 2021 after 26 years of service. And I know that we will recognize these individuals at a future meeting, but I want to thank them for their, service to our district and congratulate them on their retirement. We have a resignation, Brendan Casey, PE/health at CHS, effective February 11th, 2021. We have an unpaid leave of absence, Diane Bennett, reading specialist at Garvin, from March 8th, 2021 through the end of the school year. And we have a coaching appointment, Jacqueline Xavier, to the indoor track and field boys and girls assistant coach, effective January 25th, 2021. So I need a motion to approve the personnel actions on the consent agenda.
Madam Chair, there is no vote to be taken. That's the superintendent's hires now.
But do we need to approve it as part of the consent agenda?
Actually, yeah, we do. I'm sorry.
Okay.
Make a motion, we approve.
A second.
Thank you, Mr. DeMonica. Second by Mr. Collins. All in favor?
Aye.
Aye. The ayes have it 7-0. Thank you. The next item on the agenda is report out of executive session meeting on February 11th, 2021. Item 1 is report out of executive session votes. There were no votes taken at the meeting. Item 2 is a vote to seal the minutes of the executive session. So I need a vote to seal the minutes.
Vote to seal the minutes.
Motion by Mrs. Rogalski, second by
I'll second.
Ms. Smith. All in favor?
Aye.
Aye.
Ayes have it 7-0. And I apologize in advance if my Wi-Fi makes me look a little jagged tonight. Hopefully everyone can hear me fine. The next item on the agenda is the superintendent's report. Over to you, Mr. Mitchell.
Thank you, Madam Chair. Good evening, members of the school committee and all those in attendance this evening. The first item that I would like to share with all of you is, I just very briefly, I think it's important for the community to know, and as well as the school committee, that we conduct flu clinics at the high school every year. And I'm pleased to report that Cumberland always has a very impressive turnout. I think in comparison to other districts, we get a report that provides information on the number of community members, including students and staff that get vaccinated every year. And Cumberland always has a really impressive turnout, and this year was no different. Close to 1,200 individuals were vaccinated for the flu at the high school. And I think the organization is impressive for those folks who actually conduct this service for us and give the vaccinations. And I think it will help us as we plan for the COVID-19 vaccination. So 1,200 individuals vaccinated at the high school, I think is impressive. So that was the first item. Madam Chair, Mike, can you put up the COVID-19 spreadsheet so we can just update everybody? I think there is some good news here, everyone, as I share with you on a regular basis. There's some, I think, positive information. In fact, the number of positive cases that have increased for students and staff is minimal. As you can see, we have a running total from week to week on the number of positive cases that we are aware of in the district. All of the administrators input this information. And as you could see from last Thursday, the 5th, we only have an increase of 7 positive cases for students. I mean, 7's too many, but it is the smallest increase that we've had to date. 1 positive increase in a case for staff. And as you can see, the other data there, we are still having to quarantine both students and staff. But I think the good news is that the number of positive cases for both students and staff has been reduced significantly. I think that is good news, and let's hope that that holds true as we move forward. Okay, and we'll continue to keep you informed and provide this information on a regular basis. Thank you, Mike. Okay, so I think the thing that everyone is interested in hearing about today is our plan and the steps that we want to take for increasing the number of days that students are coming to school for in-person learning. As of right now, our students are utilizing the hybrid model, which means that they are in school for 2 days of the week. Mondays are still virtual, and 2 days they are not in school. And it is our goal to, and I think our responsibility to bring students back for more in-person learning as soon as possible. So I just want to take some time to share this presentation that we have for all of you. I'm hoping that it will answer some questions We know that we have some challenges, but a lot of work has been done, and I think we're in a good place. Mike, can you please put up that presentation? So this is the plan up to this point for increasing the number of days from 2 to 4. And to be honest, I'm hopeful that at some point over the course of the remainder of the school year that we would be able to hopefully bring students back for the full 5 days. So, Mike, if you could go to the next slide, please. As you can see, there are a number of districts from around the state that have successfully and, more importantly, safely brought students back into their schools for in-person learning. And this includes districts that, some of the districts that have brought students in for at least 4 days a week. Some of them have brought students in for 5 days a week. And as I mentioned, they have done it safely and successfully. And as we go through this presentation, I think it's important for everyone to know as well that there was a lot of individuals involved in this. Mr. Damana and his team played a role in this. All of our school administrators, our central office directors, a lot of individuals had a chance to provide input to this presentation. Our goal is to cover as many bases and answer as many questions as possible. We also know that there are going to be some questions that may come up this evening that will need more time to address. And just, I want you all to know that as the superintendent, I feel, and I know many of my colleagues in the district feel that we have a responsibility to get these students into school for more in-person learning for a lot of reasons. And there are some more obvious than others. And we are concerned about learning loss. Do we think that it would be more advantageous for students to be in school more? And will that positively impact their learning? I think most of us would argue that it would be more advantageous. So certainly we want to address any potential learning loss. We want to, we are social creatures. We need to provide more opportunities for students and staff to socialize. And we also have heard the impact that this pandemic has had on everyone's mental health. It has had a significant impact on students' mental health. And I think that is a really important reason that we consider bringing them back for more in-person learning as well. Next slide, please, Mike. So we're going to hopefully address many of these issues tonight. I think the single biggest issue that everyone is concerned about is safety in the classroom and any spaces where students and staff meet. Enrollment at each school will address. Ventilation, we've done a great job of addressing that issue. In fact, the state, I think, is impressed with the work that we have done on our ventilation system in each one of our schools. Transportation is an issue that comes up whenever we talk about bringing more students back. There may be an issue at some schools with arrival and dismissal due to increased traffic. We want to provide you with the timeline, which has changed slightly, and I think we need to be a little flexible with that, but we are in agreement with the timeline that I'll be sharing with you this evening, and we'll also discuss the remaining challenges. Mike, if you could please go to the next slide. Thank you. So here are some of the, I think, important issues that need to be addressed regarding safety in our classrooms and actually all of our school spaces. We need to ensure that there is at least 3 feet of space between student desks. And, we know that there is a conflict between the guidance provided by the Center for Disease Control and the guidance that is provided by the American Academy of Pediatrics, I can tell you that we have instances where we can meet the 6 feet of social distancing, but in many cases and in many of our classrooms, we can meet the 3-foot American Academy of Pediatrics 3 feet of social distancing. And one of the important things that we need to always keep in mind, that all of our elementary and middle school students, by the way, but all of our elementary school students, since we're bringing them back first, are in pods. And the 3 feet requirement, at least the 3 feet requirement, we can meet in every school. And remember, we are going to make sure that everyone is wearing a mask, and I'll get into that a little bit more in a few minutes. Teachers should maintain 6 feet of space whenever possible. We are in a position where we can provide at least 4 feet of space in the cafeteria between students. There needs to be at least 10 feet of space between tables in the cafeteria. We can provide that. We're in a position, given the size of some of our cafeterias in some of our schools, where students need to eat in classrooms. And as I said, students and staff need to wear their masks at all times, but masks can be removed when eating and drinking only, and they must be reapplied when done. So for those students who are eating either in the cafeteria or in classrooms, students, and this has been approved and supported by the Rhode Island Department of Health, and I checked and rechecked to make sure that this was acceptable, because I know that this is a concern, that when students eat, clearly they're going to have to remove their masks. They remove their masks while they're eating and drinking only. When they're done eating and drinking, they put their masks back on. Thank you, Mike. Next slide, please. I think we have talked about this many times, and I think we've done a very good job with our ventilation systems in each one of our buildings. We know that we are required to provide 4 to 6 air exchanges per hour in every single classroom. We are doing that now. And because of the work that we did early on in the school year, and I think we've probably did more work than any other district in the state, all of our spaces are meeting that requirement of 4 to 6 air exchanges per hour. In those classrooms that do not meet the 4 to 6 air exchanges per hour, we are utilizing one of the air purification units that were provided by the state. These are, for lack of a better term, heavy-duty air purification units, which provide at least 4 air exchanges per hour, which is required for a full classroom of students, including staff. So we are in very good shape. We also have, so we got 300 of the large air purification units provided by the state. The school department also purchased 250 air purification units that provide between 2 and 4 air exchanges per hour. And those are being used in spaces where only a few students and staff meet at a time. And we actually had a conversation today, because I think this is one of those issues that everyone is worried about. We are in a position where we can put a unit, regardless of whether, regardless of the work that has been done, and we're meeting the 4 to 6 air exchanges per hour in our units in each one of our classrooms, and many of our classrooms are meeting that air exchange. We have enough units that we can put one in every single classroom and space, and we're in the process of doing that, even in those places that meet that regulation. We are making sure that there is adequate hand sanitizer, extra masks, and other PPE in every single classroom and every building. In fact, I know that Mr. Prignano sent an email out to all of the principals just to make sure that everyone is in a good place with all of those things and whatever else they need. And everyone reported that they have what they need, and we have extra supplies of those kinds of things when we bring more students back, and more of those things are utilized by students and staff. We also are sanitizing our buildings, every one of our spaces on a regular basis. The district has purchased these handheld sprayers that spray this chlorinated sanitizing and disinfecting solution, and it sanitizes everything that it touches. Not only does it sanitize the surface of things like desktops, but don't ask me how this works, but there is science behind this. It actually is able to sanitize the underside of desks and any other equipment or furniture in classrooms. So, and that is done on a regular basis. And I think it's important for everyone to know that this sanitizing and disinfecting solution is used in hospitals, nursing homes, restaurants, and schools, and so on and so on. So, and we are doing that on a regular basis. Mr. DeJesus and his staff has a routine for making sure that that happens. Next slide, please, Mike. You probably, for those of you that have been in buildings, and you know what, there are very few people have been in buildings because of this pandemic. But if you were to walk in all of our buildings, you would see that there are traffic flow arrows on the floor everywhere, and there are tape. There's tape on the floor everywhere so that everyone knows that they have to be spaced at least 6 feet apart. Tony Damana and I were in a school today, and it's really interesting to see how much work has gone into preparing our schools, and they have been that way since the start of the school year. A lot of work was done this summer to ensure that 6 feet of social distancing is applied in every single solitary space where we have the room. And I think it's also important to note that students are provided multiple opportunities to wash hands, use the restrooms. The principals are very well organized, and they have established routines where students can do this on a regular basis. Thank you, Mike. Next slide, please. Okay, so as I mentioned, a lot of work has gone into organizing each of the spaces in each of our schools. That includes classrooms, libraries, cafeterias. So a lot of work has been done. And again, a lot of this work was done in the summer. And, you know, parents and the choices that they were given has an impact on how we respond to this. And there may be a situation, and I'll get into this a little bit more in a minute, where we may have to make some adjustments regarding a student placement. I know that's not the thing that people want to hear, but we may be in a position, and I'll share with you in a minute, the particular issues that need to be addressed, where we may have to move a few people to accommodate this particular issue of class sizes. There are contractual guidelines around how many students we can have at each of these grade levels. And I just want you to see this is the maximum number of students that can be in grades K, 1 and 2, the number of students that can be in 3, 4, and 5, and as you can see, 6 through 12. There are very few instances, I don't know if that's fair to say, but I would say in most cases, we do not have that maximum number of students, but there are some instances where we are over and need to address those particular issues. Next slide, please, Mike. We wanted to give you a sense at this point in time as to how many in-person students there will be for grades K through 5 for 4-day in-person learning, and how many students are going to remain in distance learning. And as you can see, it's actually, I think, right around 37% of the students in grades K through 5 are going to remain as distance learners. I'll let you get a sense of what those totals are in each school. So the bottom line is it's a little bit more than a third of the students will remain as distance learners. Next slide, please, Mike. I know that one of the concerns for us was transportation. Like, we were really nervous that there would be, more students that needed to ride the bus than we could accommodate. But I'm pleased to report that based on the data and work that has been done up to this point, that we are in good shape. And I appreciate the fact that parents have helped us by, bringing their students, bringing their students to and from school every day. And as you can see, there is a limit as to the number of students that can be on a bus. It is 36 students on a bus maximum with siblings, and I'll give you an example of that in a second. And if there are no siblings, that is, children living in the same home, riding the bus together, then the limit is 20. But it's interesting because most of the elementary school buses, there's more than one child from the same home riding the bus. So, there are some buses, elementary buses, that are pretty close to 36. And as of right now, there are no issues with any of our buses being over capacity. So that is good news, and one less challenge, at least as of right now, that we need to address. Next slide, please, Mike. And because more parents are bringing their students to school and picking them up and bringing them home from school, there is more traffic. And we have been working with the Cumberland Police Department, and they will have more of a presence at each of our schools as we transition into more in-person learning. There may be a situation where dismissal times have to be staggered to accommodate not only the traffic or the sheer volume of students that are being picked up by parents, but also we need to be mindful of social distancing guidelines. And there may be, as we transition into this initially, until we get more into a routine, that we may need to extend, especially dismissal times, until we, like I said, get into more of a routine and rhythm and become more efficient. We have school staff assigned to different areas of the building to ensure social distancing. And it really is interesting to see students because they are so conscientious about wearing their masks. I've seen it. wearing their masks, and being really mindful of their social distancing requirements. And so principals are they're very good at communicating, and they will provide any changes to arrival or dismissal time if necessary. Next slide, please, Mike. And let me just Mike, can you just go back to that slide very quickly? I want everybody to know that a lot of people are involved in helping us with this. So we have had many meetings, and the principals are involved in this, many meetings with Chief Damaris and members of the police department around planning an efficient start to the school day regarding traffic, and an efficient plan to organize traffic at the end of the day. Many meetings, and Mayor Mutter has also been actively involved in that. So the police and the mayor and the school department have worked closely to make this process as efficient as possible. All right, Mike, next slide, please. So I know in the last superintendent's communication that I sent out, I was hoping that we would consider starting the week after vacation, but after having several conversations with principals, they asked that they have the week after vacation to get more organized and do a little bit more planning. I think people appreciated that extra time. So as it stands right now, the goal will be to start with grades K1 and 2 on March 2nd. Now everyone's back, we're officially back on March, I'm sorry, we're officially back from vacation the week before, but March 1st is a virtual learning day, and Mondays will be, until we get really organized, Mondays will continue to be virtual learning days. So the actual day when K1 and 2 will start will be Tuesday, March 2nd. Then we hope to we will be bringing grades 3, 4, and 5 back on Tuesday the 9th. Both middle schools, grades 6, 7, and 8. Our goal is March 16th. And the high school wants to bring back 9th graders on the 9th. 12th graders, seniors on the 9th, and 9th graders on the 16th. And grades 10 and 11 will remain, we'll continue to use the hybrid model until we get a better handle on numbers and traffic flow, and ensuring that we're able to provide social distancing, which, as you all know, is much more difficult and much more of a challenge at the high school level. Thanks, Mike. Next slide, please. As I mentioned, there are a few classrooms that we need to figure out, what we're going to do, given the sheer number of students in the class and the number of students that are distance learning. So there are actually more than 97 elementary classrooms in the district, and there are 6 that we need to figure out how we're going to address that. And I can tell you that we are working with the CTA, the Cumberland Teachers Association, to appropriately deal with that. So, we're working on it. In fact, we have a meeting tomorrow, and hopefully we'll be able to get this resolved sooner rather than later. But 6 out of 97, I think, is hopefully something that we can resolve fairly quickly. The middle schools, one of the big challenges for them is scheduling. So they may need to stagger their return for each class, and the principals will be sure to keep you informed of the status of their planning, to keep you informed of when they're going to be, able to hit the schedule that I just mentioned on the previous slide. All right, Mike, thank you. Next slide, please. So to conclude, I think it's important to contact the principals directly. If you have school-specific questions, and every school is a little unique. Some schools have bigger cafeterias that can accommodate more students than others. Some, and I use Community as an example all the time. I mean, Community is the largest elementary school, and it's probably has the smallest cafeteria, so that does present some problems. But I can tell you that the administrators and staff members are creative problem solvers, and they're really good at figuring out, what we need to do to make sure that we can keep students safe and, more importantly, get them in school. We are working closely with, and I'm really pleased to share this with all of you for several reasons. The state created, and you may have heard about this, the state created almost a year ago, the Education Operation Center, or EDOC. And this particular organization was created to help school departments with a number of issues. Like EDOC was very helpful to us when we were addressing our ventilation issues. EDOC also assists school districts in bringing students back to school. So we're very fortunate to have Laura Canavan. Laura is a nurse practitioner, and she has been working with the Education Operations Center since this whole issue started back in February or March. I've had many conversations with Laura, and I'm also pleased to announce that Laura is a Cumberland High School graduate. And I've had a chance, as I have said, to meet her and to talk to her several times. She's impressive, and Cumberland should be really proud of her. And so I am working closely with her. She actually had a chance to review this presentation that I'm sharing with you this evening. She actually made a few suggestions. And one of the things that we have planned is Laura and I and others from EDOC will be visiting each of our schools as we begin the implementation process, and they will help problem solve and make recommendations as to what we can do to make this process as efficient as possible. And to me, the most important thing of all is, as I mentioned, Laura and many members of EDOC are involved in the medical profession. Laura is a nurse practitioner. Several of her colleagues at EDOC are nurses. And we're really going to focus our attention on health and safety and making sure that we're meeting all of the regulations and requirements around that really important issue. So we'll be visiting every school when we get to the point where we're doing the 4-day in-person learning. And as always, and when I send out my weekly superintendent's communication, I ask for your patience and understanding as we deal with these issues that we've never had to deal with before. And, we'll get everything worked out. But I believe that most parents want their children back for more in-person learning. I think our teachers want that too, but more importantly, we want to make sure, and most importantly, we want to make sure that we do it safely and that we're meeting all of the guidelines that we are expected to meet, because it has to be safety first. I believe that concludes the presentation. Mike, is there another conclusion slide? I think that might be it. Okay, that was it. Thank you, Madam Chair. I hope that answers some questions that folks may have.
Thank you, Mr. Mitchell. I'm sure there may be some comments or questions from the committee. So if anyone would like to ask a question or make a comment? Mrs. Feather?
There. So thank you for presenting this. I appreciate it. Just a couple of questions based on what we just saw. The elementary school, how are the switching of classes going to happen? Is the teacher going to switch classrooms, or are they going to, for math and ELA, are they going to stay with one teacher in order to stop like any kind of contamination of chairs?
Yeah, I think whenever possible, we want students to remain. So students are going to remain in their pods at the elementary level. And there are some cases, and I think using itinerants as an example, and I hope this answers your question, Mrs. Feather. There will be those instances where the adult moves. So students remain in their pods, and occasionally there may be a change in the teacher. So we want to reduce the number of changes that might occur over the course of the day. And I know that there are some principals, listening in the meeting as well. And like I said, any specific questions can be directed to them, but there will be a minimal number of changes for students and staff, and students will never change at the elementary level. It will only be adults occasionally.
Perfect.
I hope that answers your question.
It does. Thank you.
Ms. Smith?
Thank you, Madam Chair. Apologies for that. Superintendent Mitchell, could you give us an update? The school ventilation reports that were done at the beginning of the year, we did have that graph telling us which ones were in need. And then we also had it updated, I believe, from Chair Friedman's question on what our numbers would look like if we were in the hybrid where we had only half the students in at the time. Has an updated report been done now to represent a full classroom, whether it be up to 25 or up to 27? And has that been made public to the parents so they could review where we were and where we are now with the air purifiers and the updates with the venting systems? I think there's been some concern about that, and also concerns about whether or not windows still need to be maintained open, and if that report shows those updates.
Okay. So to answer your question, there is a report, and the report has been shared with a number of people. I think it's...
I apologize.
No, that's okay. We can it might even be on the website, and we can certainly put it on the website for people to access. But here's the most important thing that I want everyone to hear. We are in a very good position around ventilation. And so in all of the classrooms, like, we need to make sure that the 4 to 6 air exchanges are taking place. And if they weren't, for a classroom full of students and adults. So every single solitary space meets that requirement. And if we were in a position where we weren't able to do that, then we wouldn't be making this recommendation that we open school and bring students back for more in-person learning. So the work that we did ensures 4 to 6 air exchanges per hour in many classrooms without the air purification units that we purchased and were provided by the state. But those classrooms that don't, we have placed these large units that provide 4 to 6 air exchanges per hour. They're already in those classrooms. And as I mentioned earlier, we're going to just, I think for peace. So to answer your question about opening windows, I think some people are still opening windows because they're a little worried. They don't need to. And we've told them that. But you know what, if you need to open your window, crack your window to feel better, who would argue that? But it's not necessary. So I think just to ensure that people are comfortable, we're going to make sure that we put one of those units in every single space where students and staff meet. The classrooms will get the big ones, and those, like my office, for example. I mean, and when there's nobody in my office, by the way, we don't need an air purification unit because it's just one person or two people. But you know, my office will have one of those smaller units that provide 2 to 4 air exchanges per hour. So, Ms. Smith, I hope that answers your question. I just want to reassure people that we are in a very good place with ventilation. And by the way, EDOC was involved in that. In fact, we asked for their help in guiding us when we were addressing the ventilation issues at the beginning of the school year. And, you know, we were a little slower to actually start the hybrid model because we focus so much attention on this. So I just want to reassure people and to let everybody know that we are in a really good, probably better than most districts around ventilation. Hope that answers your question.
It does. Thank you. Thank you, Superintendent Mitchell. And if I could just ask one more question.
Of course.
The 6 classrooms out of the over 97 classrooms where you need to make adjustments, I believe it says that only 2 schools in
yes.
6 classrooms. And do we know how many students would be impacted? Is it a case of just needing to move because we're over the 25 or the 27? Or is it something else?
No, I think it's a combination of, you know, students that still are choosing distance learning and the staff that is teaching them, and the number of students that are interested in, you know, going to 4 days of in-person. So it really is more about balancing the number of students doing both. So, you know, I'll be honest, it is a little complicated because we may be in a situation, and again, this is where we, you know, I'm not even comfortable really discussing this right now because we need to meet with the union to collaborate to try and get those particular issues resolved. I can tell you that it's 2 schools, and you know, there are advantages to being small and there are disadvantages to being small. And even when things are semi-normal, right? But before the pandemic, we had issues with meeting all of the contractual requirements at Ashton because it's so small. So because of its smallness, it's beneficial. But because of its smallness, it's also a challenge. And that's one of the reasons, because of the sheer volume also of people who live in that area, families and children who are in that particular homeschool area. That's one of the reasons why we're putting an addition on Ashton School to make it a 3-track school, because right now it's 2, right? 2K, 2-1, 2. So small does present some problems. So there are 2 schools where those classes need to be addressed, Ashton and Cumberland Hill. And we're working, like I said, with the administration in those buildings and the staff in those buildings, and we are problem solving together.
Thank you.
Thank you.
Collins?
Thank you. I appreciate the presentation. So my list of questions shrunk significantly based on your presentation, but I do have some questions. For starters, with more in-person learning, there is more potential for exposure to COVID, assuming that it's still out there. But our substitute pool has not grown yet. So there's a potential for more quarantines and more staff quarantines. Do we have more substitutes to prepare to prevent more school shutdowns, or are we still kind of at the same substitute level that we have been, that has led to school closures because of quarantining and such, and positive cases?
The truth is that substitutes are still an issue, not only in Cumberland, but probably every district in the state. That is still a challenge. And I think, I think it would be safe to assume that we may, from time to time, be in a position where we need to, because of staffing issues, do what we've done in the past, and that is, have students do distance learning for a day or two or whatever. But I know that we are always trying to resolve that substitute issue. And, over the last couple of weeks, things have gone pretty well. We haven't had to, close any schools or, and do anything significant. But there's no question that is one of the biggest challenges that we face as a school department. And I know my colleagues in other places are dealing with the same thing. Something that we will definitely pay attention to.
So my next question has to do with the parents. You mentioned most parents and teachers are in favor of the plan. Do you do a survey, or is this just in your conversations with people?
You mean, have we surveyed to see if people want to go from 2 days to 4 days?
Yes.
Yeah, we haven't done a specific survey on that, but I can tell you that, and I'm sure you have too, I have been inundated with, there are some parents who are legitimately concerned. Who would argue that safety is not something that is paramount in, every parent's mind. But I have received probably more emails from parents who want their children back for more in-person learning for a lot of reasons, and they cite them in their emails. And there are parents who are saying, why aren't we doing 5 days instead of 4? So I don't have specific numbers, Mr. Collins. My instinct would tell me that, that more parents would prefer more in-person learning than to maintain the status quo. But I think we would have to, the only way to really determine that number would be to do a survey.
The only other question I have with parents, and I'll give somebody else a chance, is in the event that a student is switched out of the class, or there's a busing issue or whatever, how are parents going to be notified that their child is being moved from one classroom? Because I agree with the email sentiment, but that for parents who are concerned, aside from people who are still concerned about virus, there's a lot of concern about my child won't get this, won't have his teacher anymore. What will be the metric be based on that?
The plan
and how
right
they'd
now,
be notified.
The plan right now would be for the principal to contact the parent to let them know. But we're, hopefully we can, hopefully we can work most of this out. But you know what, one thing that I've learned, I'm never going to make any promises that we can't keep, but our goal is to minimize that disruption.
Mrs. Rogowski.
Thank you, Madam Chair. First, thank you, Mr. Mitchell, for your presentation. Definitely helpful. One thing that, and I realize, and in everyone I've spoken with, there's no right answer. It's bad plan A or bad plan B, and we're just all doing the best that we can. And I agree. The number of emails for parents wanting kids to go back, probably double the number of emails that I received for the opposite. However, what I've also received are a lot of emails from teachers, and they are scared. And I've heard a lot about students and a lot about everything else, but have we talked to teachers? I mean, I have teachers emailing me saying, I cannot physically be 6 feet away from my students. I can't be 3 feet away from my students when they're doubled. Some of these rooms are small. And I have teachers who have said, I'm going between 2 schools. I'm a music teacher. I'm an art teacher. I'm a counselor. They're doubling or more their exposure. And I know a lot of people are saying that it doesn't double, it's the same number. And I like to think of it as you're swimming with jellyfish. You're swimming with 6 jellyfish on Monday and Tuesday, you can space yourself out. But if you double Monday and Tuesday and Thursday and Friday, you're swimming with 12 jellyfish, there's not a lot of room. So it really is doubling the exposure as much as parents can't see that. And I'm not hearing a lot about what teachers, and I think I'm just trying to kind of speak for them right now because they are scared. And I'm just wondering how we plan to address that with them. And are we taking into account their feelings? Have we surveyed teachers? Have we talked to the union? Anything like that? That's just a question.
Yeah. Of course, we are sensitive to the feelings of teachers. And I understand their concern. I mean, I think most of us, have concerns when we have to do anything publicly outside of our normal routine. So I'm not, we're not insensitive to the anxiety that teachers may be feeling about this. So I think all we can do is do everything that we possibly can to mitigate any potential exposure, be mindful of, social distancing. And I think teachers are in more of a position, and I'm sure that there will be some people who disagree, and we're at a time where people disagree about everything. But, to be mindful of 6 feet. I can tell you that teachers have been involved in conversations. I can tell you that teachers have been part of the problem-solving process. That's the truth. In many instances, in helping us get students back. So, I think one of the things that's important for us I think the science is important, and some of you may have heard about this Binax testing that is taking place. More than half of the school districts in the state, and I'm just sharing this because I think this is important data. More than half of the school districts in the state are doing this Binax testing, where they are testing students on a regular basis. And we are going to consider that as well. So less than 1% of the students are testing positive, less than 1%. So I think the science there is important. And I think, the science also tells us that there is very little, and I don't know that there has been any instance in the state of Rhode Island where the spread of this of COVID-19 has taken place in a school. And I think it's because of all the mitigation strategies that are in place. So I think I don't want to be insensitive to how some people are feeling. I get it. People are nervous, but I think all we can do is support them, listen to them, and make sure that we provide every mitigation strategy that we possibly can to ensure that we keep them safe and we keep the students safe. And all of these other districts that I mentioned, and there were more that I could have included, but I just wanted to give some sense of the school districts that have been doing this for a while. And I'm guarantee you that they're not all 6 feet of social distancing in every classroom, that they're doing okay. They're safe and they're doing okay. So I guess all we can do is listen and support everyone as best we possibly can, and make sure that they have everything that they need to keep themselves and their students safe, and just work with them. I think that's a good place to start.
And just one more question on a different note. I know that we have some counselor and interventionist shortages just in the district as a whole with cuts that have happened. Is there any concern about straining the system with all of the students back in school, since we are hearing from parents that students have developed, some mental health issues with anxiety or learning issues or having any difficulties? Are you worried that there aren't going to be enough support specialists in the school with everyone back if these kids truly have developed any issues while they're out?
Well, that's a good question, and I think we're really going to have to pay attention to that when we do return. And I think once we have some data on any increase on the number of issues that needed to be addressed, then we're going to have to respond in some way. I don't know exactly what that is, but it seems to me that if school counselors and social workers and psychologists and our mental health people are overwhelmed, then we're going to have to respond in some way. So I think we're really going to have to pay attention to that.
Thank you.
Mr. Collins?
Thank you, Ms. Rogalski. Your question shortened my list even more. This is good. I do have a question though. Tonight we had, if I remember correctly, we had one teacher requesting leave for a medical, I believe. And it's my understanding it's a 30-day requirement to request a leave. I don't know if Katie can confirm that. But now this is the first time we're really seeing a plan. And students will be returning in 19 days. So if a teacher has a concern now based on what they've seen tonight and wants to request medical leave, will that 30-day requirement be waived?
So I'm not going to comment on an individual or anybody who requested a leave tonight. Specifically, there is no 30-day requirement for medical leaves. That is for non-medical needs. So that's in the contract.
So would you be willing, because again, they're only first finding this out, if there's a personal leave request, would you be willing to waive it? With students returning
if there's a specific request, I would ask that come to me and Mr. Mitchell. I don't want to. I think that would be the proper channel.
Okay. I do have a follow-up. I actually have a question. I actually think it's a great plan, and I just want to preface this by saying I actually support the plan. I like the idea of kids returning to school. But one of the issues is that when we tackled this issue in the fall, we had deliberations and we voted twice. Tonight we're not voting. Why are we not voting? And that's what my question. Not that I'm against the decision of returning them to school, but now we're suddenly unilaterally sending the kids back. And I'm more questioning the process than the actual outcome.
Mrs. Friedman, do you want me to answer that, or do you want to answer that?
I think there's part of it for you to answer, Mr. Mitchell.
No. Well, I certainly, let me just say that I certainly don't have a problem, asking for the support of the school committee in making a decision on this. But and that, if that was the school committee's choice, and certainly your prerogative to do that. I just want everyone to know that our schools are safe, and that as the superintendent, I believe that we have a responsibility to bring students back. So, I mean, I certainly do not have an issue with the school committee taking a vote on this, if for the sake of consistency, or I'm perfectly fine with that. I guess the thing that I think about all the time is I worry about students. I worry about our staff, but I see how everyone else around us and all those districts that I mentioned are doing it. I think we can do it too. And I know that our schools are safe enough for us to do it. And I think that's critical. So I mean, that's my position. And certainly that is, Madam Chair, and if the school committee wanted to vote, I'm perfectly fine with that.
So it was the school committee's choice. Is that what I'm hearing, Mrs. Freeman?
There's a decision about what gets put on the agenda. Yes. And I think there were the announcement last Friday or whenever it was, the communications that went out from Mr. Mitchell to the community. I think that could have been handled in a different way in terms of the order of what we're doing. And I think that kind of put us in a little bit of a tough spot with the way that was communicated, because I think we did expect to have more of a discussion before an official announcement went out like that. But with that going out and the understanding of the what is being done and now the plan, it is technically, as I've said before, not something that we need to vote on. I know we had voted in the past, but we haven't voted every time. When we choose to put kids to virtual or close a school or whatever we might do, we don't vote on those things. But in this instance, in general, Mr. Mitchell has the authority to make these kinds of decisions.
No, I'm just confused a little bit right now, because it almost sounds like he's saying it's your choice and you're saying no, it's his choice.
Well, let me. Okay. Let me. And to be totally honest, I have to accept responsibility for putting out in that communication last Friday that we were going to be bringing students back the week after vacation. I have to accept responsibility for that. I should not have included that in my communication. And just so that you all know, the reason that I did it was because I wanted to give parents and staff an opportunity to prepare for that. Now, in hindsight, I should not have done that. And in defense of Mrs. Friedman, not that she needs me to defend her, I at one point said to her, I think the school committee should vote on this. So I have to accept responsibility for that, and I do. So, I mean, I think this is on me. I made a mistake by putting that information in my weekly communication, and just so that you know, I did it. I did it because I wanted to be transparent, and I wanted to give people an opportunity to plan accordingly. So, I mean, if I had to do it all over again, I certainly wouldn't. And just, I mean, and truthfully, I mean, in combination with all that I'm going through personally, I shouldn't have done that. So let me publicly apologize. I especially want to apologize to Mrs. Friedman because we had a conversation about this going to a vote. So this is not like, so that's the truth. This is on me.
So the way I'm reading it then is, and it makes sense. So the way I'm reading it is the emails get sent out. The school committee is kind of blindsided. I know the teachers were blindsided and parents were as well. Mrs. Friedman sets the agenda, says what's the best way to handle this. So from a damage control sort of standpoint, or just from how do we move forward based on what's already happened without further complicating things, Mrs. Friedman sets the agenda, and she sets the agenda without a vote, correct? Is that accurate?
I did make that decision, yes.
So you made okay. So you made the decision.
I made that decision in talking with our legal counsel about getting clarity around whether we needed to vote or not. And given the circumstance and whether it could cause more disruption or not, and looking at what other school committees have done, because that has also been inconsistent across the state about whether a school committee votes or doesn't vote on this. And technically under the general law, the school committee does not need to vote. And so I, had those discussions with Mr. Adams and with Mr. Mitchell, and that's the decision that I made.
All right, so my two concerns with that is that you consulted with other school committees, but not any members of this school committee. Unless you did. Did you consult anybody on the school committee? And I just want to say this too. I'm not trying to interrogate you. There's an end. There's a precedent that I have concerns with that I'll kind of detail. So did you consult with anybody on the committee now that we figured out kind of where we're at?
Mr. Fiorello, Mrs. Feather, you have your hands up?
Yes, I just want to state that Mrs. Friedman and I did have a conversation after the fact. I think it was on Monday or Tuesday, and I expressed my desires I have all along through this whole process, that we receive the proposal for reopening, we get a chance to digest it, ask questions, and then we would actually get a vote on it. So I just want to make that clear.
So, what I wanted to say is not that we communicated or anything. It's just that I do believe that we all received an email with the research that Karen had, Mrs. Friedman had done on the other schools. And I think that was probably what she's referring to about consulting with those other schools.
Yeah, that's right.
So now just to finish up. So moving forward, someday COVID will be behind us, but we have other issues facing us. When we have controversial issues, such as, redistricting, and if all of a sudden a parent or somebody finds out that the district that they currently send their children to no longer ends in their driveway, you know what I mean? And all of a sudden they don't have a say and the school committee doesn't vote, and unilateral decisions are made that affect a lot of people kind of like this. I would just hope that the committee itself would have more transparency and we would actually get information at a time so we can vote and we can answer to our constituents, parents, and teachers and students. Because this is a bad precedent, I think, quite frankly.
And also the committee can at any time propose items for the agenda as well. So that kind of conversation can happen as well.
But in this instance, we didn't know what was going on because we were kind of left in the dark. So that's a concern. What's done is done. It doesn't change anything, but moving forward, it's really, really important that we have a say in what actually happens to the schools. And this is a very important decision, as evidence, and there's going to be people speaking in public comment. I'm happy with the decision to open the schools. I'm not trying to railroad anything, but moving forward, the process, I do have concerns with based on this tonight.
Thank you. Mr. DeMonica, is your hand raised? You muted.
I did. Here we go. All right, so I just have a question in regards to the high school. From what I see, we got approximately 700 kids coming back to the high school, and we know that's been a hotbed. Are we going to have enough classrooms for all the children coming back, the 700 kids coming back? And more important, are we going to have enough adequate spacing for these kids when they get to the school? Anyone can answer that one?
Well, I can tell you that I've had preliminary conversations with Mr. Costa.
I don't know if people can hear me, but I'm here, Mr. Mitchell.
All right. Do you want to take this, Mr. Costa?
Absolutely. Good night, everyone. Nice to see everyone. So far, what we've done to prepare for more students being back in the school is we have approximately, and I have some information written right here, we have approximately 807 class rosters that I started going through. I have 116 left to go. There is 89 class rosters that with hybrid students, and when you remove the students who've chosen distance learning, we have approximately 80 rosters that have 20 kids or more. Then we have to go back and look at the number of students, and this is what's left to do, the number of students that might be juniors or sophomores. Currently, we have 130 seniors that are A group students, and we have 111 students that are B group students. So if we brought seniors back, it would be the combining of those two numbers. That's the additional students, which in what I would consider phase one. The reason why we selected grade 9 as the second group is because they are the least likely grades to have classes together. It will not significantly impact class, the number of students who are in person at that time. Today, I spent a considerable amount of time measuring, because at the high school, we have classrooms whose square footage is all different sizes. So today I walked around with my tape measure and we measured desks and where students were sitting next to each other. And I would say that I did not find a classroom where we couldn't comfortably sit at least 20 students going by a 4-foot rule.
Okay.
I will
then-
say
go
that
ahead,
I
I'm
will
sorry.
say that the only thing that we need to take a closer look at is we have two types of lab tables in science rooms, ones that allow for more spacing for students, and one where students kind of angle towards one another. And it's the ones where the students angle towards one another that I'd want to take a closer look at those rosters to see what the exact number of students in that class will be when you subtract the distance learners. So this is all the work that we're doing now at the high school to prepare for spacing.
Okay, and then Mr. Costa, I don't know if you can answer this one yet. I mean, obviously sports have started up, and if we're not bringing the 10th graders and the 11th graders back yet, how are we gonna sort of integrate those kids into the high schools so they can play sports? Has Mr. Blanchard kind of figured that one out yet?
Yeah, so at this time, we do have athletics going on, basketball's going on. Those students just come at the end of the day. So right now, if you're a B group student and you had practice today, you wouldn't have been in person, but your parent would have brought you at 2 o'clock so you could attend, or 4 o'clock or whenever practice was. No student has been eliminated from any activity
Okay,
due to the
great.
distancing, and no one would continuing forward.
All right, thank you.
Mrs. Rogalski?
Thank you, Madam Chair. Since I know that a lot of 10th and 11th grade parents out there are going to be a little put off by the delayed start, do we have any idea how long until we would like to try to get those 10th graders and 11th graders in? Are we talking a week, 2 months? Do you have any idea for those parents?
So, Mr. Rogalski, I think the plan needs to be slow and very purposeful, only because the big thing for us really is eating spaces. So we want to see what the impact of first one grade would be, then the next grade. And then as soon as we have data, we would share it with all of you, and we would make a decision together in terms of, are we ready to bring more students back into the school? And to be honest, you're right on point. We've received lots of communication about parents who, my kid's struggling, I just want them to come back 4 days a week. And for me, it always lies with equity, right? I want to be able to tell everyone today you can come back 4 days a week because it's important that kids are in school. But for safety purposes, I believe we need to go slow here. But I would not say months, no. I would say, we evaluate things over like 2 weeks at a time.
Okay, thank you.
Any other comments or questions? Mr. Collins?
sorry, this will be short. Is there any potential, I know a lot of the building administrators are here, but I was just looking at the notes regarding the spacing in the classrooms. Would it be possible to see this? I know the safety concerns and the school vacation next week, which would be ideal. But is that something, Mr. Mitchell, and any of your building administrators individually could facilitate? I don't know. I'm sure other members may want to see it, but I absolutely would like to see some of these schools and what it's going to look like.
I believe I know I'm speaking for them, but I've asked them before. In fact, I know that Mrs. Friedman and I have had a conversation about this. Yeah, I mean, if I would recommend that a school committee member reach out to a building principal, and let me just say this. I mean, I don't believe that. I mean, I don't know that anyone has taken a vacation in the last year. So I know that there are, and I'm included. I know that there are people who are planning to take some time off next week, but I think administrators would be happy to have you come in and visit their schools and see firsthand all the work that's been done to make them safe. So yeah, I would say reach out to the principals. They've all told me that they are more than willing to have school committee members come in and see how they've organized their schools.
Mr. Mitchell, I will just add that tomorrow at 9 o'clock, we're gonna analyze the cafeteria again for the new spacing guidelines, and I welcome anyone to come to the high school at 9 o'clock and you can see how we go through that process.
Okay, thank you, Mr. Costa. Any other comments or questions before we move on in the agenda? Okay. All right, thank you, Mr. Mitchell, for that. Will that presentation be shared on the district website?
We can do that, Madam Chair.
Okay, thank you. And I think different schools are having different kind of like Zoom
Forums.
meetings,
Yeah.
forums for parents and teachers and such. So again, reach out to your individual building principal if you have individual concerns. Okay, thank you. So moving on to the next items on the agenda, which is reports of standing committees. The first one is the Fiscal Management Subcommittee update. Mr. DeMonica.
Madam Chair, we did meet tonight. We talked to Mr. Pregnano. He gave us an update on a monthly report. We are trending towards a positive amount of in our cash flow. We got some good news from the state. They have lowered the amount of statewide busing charges that they were planning on charging the school district. So that has kind of helped us in regards to the budget at the moment. We also talked about the solar power that the town entered into, and we're just waiting to see some positives on that one as well to help with the budget. More important, Mr. Pregnano brought up, to give an idea, we're having another meeting tomorrow night at 6:15 to move some money around. We got issues coming up where the school department's going to be spending about $800,000 on new curriculums that RIDE is going to make every school district in the state purchase, even though you may be a top 3 or 5 or 8 school district. They're still gonna make you spend the money for new software, new curriculum, and it's gonna, so we're gonna start to budget that money and set it aside. So we're gonna have a special meeting tomorrow night just to take care of that, so that the auditors can take care of their report on Monday. We heard from Mr. DeJesus in regards to facilities. We had a 6-inch elbow go for the pool area. So the maintenance crew that we have at the high school, plumber and electrician and so forth, got that taken care of, but we did have a leak, and it's been taken care of. Next is we have on our agenda for later for approval to start doing some abatement testing for the $79 million project to get that going. And we do have a resolution to approve tonight for the E-rate money that we get from the state for technology in the district. I do want to note that we will have discussion tonight when it comes to payment of the bills, that I've asked that the payment of bills be separated out because we have one vendor that we want to seek additional information on before we vote to pay that bill. So that's where it stands tonight for fiscal management, and we'll get the resolutions later on. Thank you.
Thank you, Mr. DeMonica. Next on the agenda is Policy and Procedures Subcommittee update. Mr. Fiorello.
I'm sorry, my temporary thing wasn't working. We did not meet this past week. Hopefully we will be able to meet in 2 weeks.
Thank you. Next item on the agenda is the Achievement and Communication Subcommittee update. We also did not meet and need to schedule our next meeting. The next item is the District Health and Wellness Subcommittee update. Mrs. Rogalski?
Yes, we have not met as a committee. I am waiting. I did meet with Ms. Carbonic and Ms. Malcolm. We went over that. I also met with Karen Wetherill from the Rhode Island School Healthy Schools Commission, and Dr. Santa has been in touch as well. I'm waiting for a couple of principals to send me members. We're kind of rebooting the committee in the hopes of getting a meeting on the books within the next month.
All right, great, thank you. And okay, the next item on the agenda is comments from the public. And so if you want to make a comment, you can raise your virtual hand if you're in Zoom, or if you're on the phone, press *6 to unmute, and then you will state your name and your address, and you will have 3 minutes. There's a 3-minute limit, and in most cases we cannot respond to comments, but if you do ask questions, we can make a note of that and have whomever the right person is get back to you outside of the meeting. So, Mr. Chandler?
Yes.
Do we have anyone with their hand raised?
We do. We do. Jessica Macedo.
Welcome, Mrs. Macedo. State your name and your address, please. Thank you. Oh, you're muted. You're muted.
Sorry. My name is Jessica Macedo, and I live at 404 Angel Road in North Providence. So, Mr. Mitchell, Mr. Damana, and members of the school committee, I am addressing you this evening with my concerns about returning as many students as possible to in-person learning 4 days a week. There are classrooms in my building that have up to 25 students. In these rooms, keeping the 3-foot distance between students is already a challenge, which will be nearly impossible with more children. Furthermore, I share a room with 2 other reading specialists, and I worry about having students from multiple pods in one room when we are all instructing in person. Believe me when I say that faculty, staff, and students have been doing their due diligence in following the distancing and sanitization protocols at my building. But I know myself and others worry that these procedures will not be enough if numbers are increased. Additionally, I am troubled about the timing of returning soon after winter break. There very well could be a spike in cases in Rhode Island, which could consequently lead to more cases in schools. I understand the desire to bring more students back into school buildings. I miss seeing more of my students face to face, and I experience the challenges of distance learning daily. Also, I empathize with the burden the situation puts on families. But I am asking that if we cannot wait until faculty and staff can have the opportunity to be vaccinated, which would be the ideal, then at the very least, you consider waiting until 14 days after February vacation to increase in-person learning. Thank you for your time.
Thank you, Mrs. Macedo.
Danielle Pushin.
Welcome, Danielle.
Hi, my name is Danielle Beauchesne, and I reside at 4 Vet Drive, Lincoln, Rhode Island. I just wanted to take this time to speak. I'm a kindergarten teacher at BF Norton. I work with Miss Macedo. And I would just be remiss if I didn't take this opportunity to highlight my concerns about returning to full in-person learning so quickly. While a survey was distributed to families for their input, no such survey was sent to all staff members for our input. Our building reps created a survey for educators, but unfortunately, before the results could be submitted, a letter was already sent on Friday. And I had many families contact me over the weekend asking questions that I could not answer, as I had the same amount of information they did. And for that reason, I would just like to take this opportunity to share with you what my in-learning classroom experience has been for the past 5 months. I have 14 students on Group B days and 11 on Group A. If we put that all together, I have 25 students, which is technically 2 over capacity for kindergarten. I have 25 students that will be in my room eating breakfast, lunch, and snack maskless with only a cardboard divider to ensure protection. I am constantly telling these 5-year-olds to pull their masks up and to turn around while eating because they naturally want to talk to their friends and they can't do so with the dividers as they're too little to see past them. I have measured the distance between the desks, and with a full return and having 25 desks, I will not have every other child. They will all be full, and that is only 2.5 feet between them. And it is really quite baffling to think that we can have students this close. And the common refrain is that the majority of children do not get COVID as severe as adults, which we know, that's great. However, statistics show that they are still contracting it and can be asymptomatic and pass it along to others, such as adults. And at the last school committee meeting, it was stated that teacher vaccinations would be taken into consideration when planning for a full return. And yet the following week or so, it was announced that we would return the week after February vacation. I am glad to hear that's been pushed back a week at least, as Jess Macedo said, for quarantining and traveling purposes with families. And now the new state vaccination guidelines have removed teacher categories completely from phase 2 and instead created new vaccination guidelines based on age, geography, and high-risk conditions. And that's all I wanted to say. Thank you for your time.
Thank you, Danielle.
We have Sean Beers.
Hi, my name's Sean Beers, 70 Brookdale Street in Cumberland. I'm a parent of a student that goes to Garvin, and I heard Superintendent Mitchell talking about adding air purifiers to all the classrooms, and in most cases or all cases to do that regardless of the air exchange over protecting people. And I just wanted, well, I was hopeful that these purifiers would also be added to the cafeteria where you might have 60 unmasked students and staff. So hopefully multiple air purifiers would be there. And as far as the busing goes, I didn't know if the busing would stay the same as it's constructed now or go back to the normal routes of last year. And if you want to take the bus, you just go, or would this be something that you'd ask the school for if you wanted to send your kid on the bus or not, and then they would approve or deny that request? Thank you.
Thank you, Mr. Bears, and I'm sure the principal of Garvin can reach out to you and help answer those questions for you too.
We have Francesca Bodwin. Francesca?
Hi. Yes, hi, Madam Chairwoman, committee members, Superintendent Mitchell. Thank you for your diligence on this topic. My name is Francesca Bodwin. I live at 9 Gold Star Drive in Cumberland. I'm the parent of 3 school-age children. I'm a physician, a scientist, and a concerned resident in Cumberland. And thank you for hearing some brief thoughts that I would like to share. First, I would like to give a kudos to Superintendent Mitchell. Throughout the pandemic, I think that he has done incredible diligence, and he himself has become a scientist, as have you by de facto, since everything has been going on. And so he has become a fierce advocate for the children in this town, and I appreciate everything that he's done. Next, and I want you to know that I actually don't have any personal stake in this decision tonight to open the schools. I withdrew my children from the public school system 3 days before the start of the school year after much deliberation and with a lot of concern and thought. But when there was the decision to start fully remote and when there are insufficient details in place about how my children would learn remotely, I removed them from the schools with great hesitance. I want you to know I'm a strong supporter of the public schools. That's why I'm here. I'm a product of public education, starting in kindergarten through high school, college, and even medical school. But now I'm an unfortunate example of widening educational gaps created by the pandemic. I had the privilege and the means to make a choice for my children to attend school in person through private education, and not everyone else has this choice. There's still a lot we don't know about the pandemic, but science supports that in-person learning can occur safely. And it's really imperative that we do so for the physical, social, and emotional well-being of our children. The only reason I'm here tonight is to advocate for public health, and that includes mental health and well-being. And I want to reiterate to all of you and all of you on this call, particularly the teachers, you are prepared, you are equipped, and it is safe to go back in schools, even though it might not feel that way. It's the same way that we felt in healthcare. And I spoke to this committee back in August, kind of saying much of the same thing, but it's the truth. And I'm hoping hearing it again might make a little bit of a difference. Providence opened their schools. The students returned, the teachers returned. They were more challenged in many ways than we were as a district, but they made it work. And echoing the words of our CDC director, schools should be the last place to close and the first place to open. There was a CDC study that demonstrated that when masks and other infection control measures were implemented, the rate of spread in schools was lower than the community. And this is mirrored in our own state. Rates of cases of children who are distance learning are higher than those who are attending school in person. There are multiple studies showing that schools are not a vector for transmission. Our state is very transparent. This data are available for review. And some last things I just want to leave you with is that this is not just about educational gaps and learning loss. Child abuse cases are down 51% in this state. And that's not because it's not occurring, it's just not being detected, because schools were a major place where this was detected. As all the teachers know, they're mandatory reporters. Increasing youth depression and suicide, substance use compared to the same time period in 2019, suicide rates have almost doubled in adolescents. Food insecurity, children relying on our schools to eat. We just heard from a teacher of her students having multiple meals a day in the classrooms.
I'm sorry, Doctor, you've gone over the 3-minute limit.
I will end. Thank you all. I appreciate it.
Thank you.
We have Carrie Carlson.
Good evening. My name is Carrie Carlson. I am an educator at the middle schools. I am a resident for the town of Cumberland, and I'm also president of the Cumberland Teachers Association. I think it's important to let everyone know that the Cumberland teachers want to bring as many students back as possible. And we realize that in-person learning is what's best for our students. However, we want to make sure that's done safely. Since the conversation began about bringing more students back, we asked that we have a process set up to address our safety concerns, and that we also have the opportunity to negotiate the changes that would impact our working conditions. Unfortunately, that didn't happen initially. I am happy to report that we had a meeting earlier this week with Mr. Mitchell and Ms. Duncanson, and we have another meeting planned for tomorrow, and I'm hoping that we'll be able to make some progress in those two areas. The CTA building reps did survey their members to get some data about their feelings about returning to school. Quite often I hear from people who are dissatisfied with a decision, but not those who are satisfied. So that's why I wanted to reach out and collect that data. 68% of our members are not in favor of returning to school because of safety concerns. And I know many people will say it is safe to return to school, but the dilemma these people face is every day they hear in the media from health authorities like the CDC and the FDA and Harvard Medical School and the Rhode Island Department of Health for that matter, that layers of mitigation are necessary to be safe, which include 6 feet of social distancing, mask wearing, hand washing, etc. You really should not be with people outside of your own household. Yet these same people are being asked to come into school buildings, to be in a classroom with 20 plus children, to be less than 6 feet apart, to be with students while they have their masks off and their aerosols are throughout the room. So they're not trying to be difficult. They're not trying to not do what's best for students. They're scared. Some of them have many risk factors of their own. Some of them have family members with risk factors. I hear from people who tell me stories about their spouses who are fragile, medically fragile, and how scared they are to go home and give COVID to them. That could result in horrible circumstances. They have friends and family who have lost their lives or who have long-term health effects. So I think we want to balance the risk and the reward of bringing students back. And I think it's important that we work together to address the concerns. And I think until we address those concerns and work out these details, it doesn't make sense to move forward. But I'm hoping that we can work together and we can make that happen in a safe and reasonable manner.
Thank you.
We have Andrea Friedland.
Hi, I'm Andrea Friedland. I live at 47 Greenfield Road in Cumberland. I'm a teacher at community school. So my main concern that I have, yes, I would love to be back in my classroom with all my kiddos. I have 24 that I would love to have with me every day. But I have dividers that are cardboard that they can't see over. So that is a concern because they have snack and they try to peek over on the side. So it doesn't really help them. So that is a concern. So I did talk to my principal and I have emailed a couple of school committee members as well about plexiglass. And I did talk to a couple of my friends that do teach in Lincoln because I know that they are successful. And they have plexiglass dividers in Lincoln, which is why they are so successful now. So hopefully that would be something that can be considered that could prevent us from having any other issues, and that would prevent me from being on my third quarantine. So I've already had two. So it would be great if I didn't have to do that. But if we could consider that as an option instead of the cardboard dividers, that yes, they are getting cleaned every day and sprayed, but they definitely are not a safety. They can't be any safer than plexiglass, being that they are cardboard. So that is the only comment that I do have. So thank you very much.
Thank you, Mrs. Friedland.
Jody M.
Hi, how are you tonight? This is Jody McGill. I live at 2 Bishop Drive in Cumberland. First and foremost, I do want to thank Mrs. Rogalski, and I also want to thank Mr. Collins for mentioning teacher safety at a time where sometimes I think a lot of us feel like no one really cares. It really meant a lot that you brought that up tonight. More than anything, I want all of my students back in my classroom. We have pretty big classes this year, so I'll have 25 when they're all back. So day to day, it's actually easier to have all my students in my classroom with me. My home life gets easier. My school life gets easier. The kids are happier. We teachers are happier. But on the other hand, like Kerry said, we're scared. You know, we're making day-to-day decisions in our personal life. And, you know, not going around a lot of people, keeping ourselves safe for our family members. And then when we're at work, that it feels like all of a sudden the rules don't apply anymore to us and no one's really concerned about our safety. You know, the CDC says we have to have 6-foot guidelines. Yet now, because it's not convenient, we're going to move to 3-foot guidelines and follow the American Board of Pediatrics. I just, having 25 students in a room unmasked while they're having 2 snacks a day and a lunch, I wouldn't put myself in public and do that ever. So I just wanted to put that out there. I mean, for me, I really just truly want to get vaccinated. I'd love to have some plexiglass instead of cardboard. And I really want to get back to school. I really want to be with my students. I just wish there was more of a push for people to be, instead of pushing that right away that the kids come back, I just wish we would really push for teachers to get vaccinated and really make a push for that, because I think we all want to be back in those classrooms and we want our students in front of us every day. We miss them just on that off day. We don't see them. So thank you very much for listening. I appreciate it.
Thank you, Mrs. McGill.
At this time, I don't see any other hands.
Okay, we do have another public comments after our new business. So if somebody does want another opportunity, that will come up. Thank you to everyone who came out to speak tonight. The next item on the agenda is new business. And the first item there is the school counselor's data presentation. I'm not sure who's taking this one.
Thank you, Ms. Friedman. The entire school counseling department is present this evening, and multiple people will be speaking throughout the presentation, but I am going to start it off. And I believe Mr. Chandler is going to present the Google slideshow for us.
Yep, it's coming right up.
Thank you. So thank you for the opportunity. Let me introduce myself again. I'm Carrie Carlson. I am a middle school counselor at both McCourt Middle School this year and North Cumberland Middle School. This evening, the K-12 counseling team wanted to present some data to you. We are grateful and excited to share this information about our roles at all 3 levels, the elementary level, the middle school, and the high school. Next slide, please. So this school year, drastic cuts were made to the school counseling program. Previously, we had full-time counselors at each elementary school. We currently have part-time counselors at the 4 of the schools, with only community school having a full-time counselor. Prior to this year, we had 2 full-time counselors at each middle school. Now we have 1.5 at each school. There was also a change in the structure of the high school counseling department and 1 less position there. In addition to the personnel cuts in school counseling, the additional work days that counselors have worked, which was 10 days for the 10 years that I have worked in the school counseling department, those days have been cut to 5. So as you can see, drastic cuts have been made. Nearly 27% of the school counselor positions were eliminated. And as much as school counselors work to the best of their ability to meet the needs of their students, cuts like these negatively impact our students. If you could go to the next slide, please. If you could go to the next slide again, please, Mr. Chandler. Thank you.
Hi, this is Cindy Lancaster, and I'm a school counselor at McCourt Middle School. We skipped the last slide because we thought it'd be better to sort of show you with a visual what this slide is all about. Basically, school counselors do not work in isolation, and we are an integral part of the total academic program. We collaborate with teachers, students, parents, administrators, but also outside clinicians, doctors, hospitals. We call it DCYF, sometimes the police. But this slide is all about just the school mental health team. And I think it's easy to confuse the roles of school counselors, from school psychologists to school social workers. And so this visual, I'm hoping, will help show you how we are all integrated and work together as a team in a tiered system. And this is K through 12. You notice that the triangle is divided into 3 vertical domains. The first being academics, and I would add career planning to that one, behavior, and wellness, which we talk about as social emotional concerns, safety concerns, that kind of thing. So at the very base is the foundation, which is for universal interventions. And that would be things like our lessons, of a comprehensive school counseling program. It's for all students. It's a tier 1 intervention. So that would be universal lessons that are proactive. They are developing skills over time through the different levels, and they are preventative. And it would be easy to think that these lessons are something that we could do if we could afford it. But I want to give you one short example of how a lesson on personal safety that I did when I was a counselor at Cumberland Hill was on a lesson about, if big problem, little problem. If you have a big problem, go to an adult. If you hear questions about statements about personal safety, come see a counselor. So a student overheard a classmate say that another student wanted to hurt themselves, and that student came forward. I met with the individual. And following protocol, we decided that a risk assessment was needed, and we got the school psychologist to come in from another school so that they could do an interview and determine the level of concern. It resulted in that child being hospitalized. This is just an elementary kid now, hospitalized for several weeks. And the mother called me later because she wanted to thank that classmate, because she said, that student saved my daughter's life. Not only did her child have a plan for how to terminate her life, she had been practicing in the kitchen, which came as a complete shock to everyone in this child's life, from the teacher to the parent herself. So that's just one example of how what can seem like a really simple thing, like a universal lesson, a tier 1 intervention, can feel like fluff, but it can really result in something not happening. And I can't provide you with a bar graph of something that did not happen, but that example illustrates the importance of having school counselors available so that teachers are not handling those situations themselves and just having the child go back to, or not having the student come forward. So tier 1 is really enough for most students. We have lessons on all of those 3 domains, but like in any other skill, like reading and mathematics or writing, sometimes students need more, and they're in the tier 2, sort of the yellow zone. You notice that this is a smaller group of students, but the work is more intensive. A good example of how this would be is, let's say we've done a lesson, a universal lesson on the anti-bullying policy and how to come forward and make reports. That's a very thorough and complete policy that Dr. Masterson developed. We do universal lessons about how to handle conflict, but if the problem continues, how to file an incident report. We do that every year, 6th, 7th, and 8th, to remind the kids not to tolerate and not to watch something happening. From that, we might wind up having to do a peer mediation. It depends on the situation, of course, but get the parties together so that we can sort of resolve the conflicts, talk things out, and maybe agree to disagree and get along. Other times it might result in a social skills group or a lunch bunch to help develop some social connections. In the worst case, it winds up being referred to administrators so that they can do an investigation and take disciplinary action and involve parents. And that often results in the targeted student, the person who was the victim in this situation, being put on something called the safety plan, which is in the policy, so that they feel safe and supported and that they can report any retaliation, which is a huge part that holds kids back from coming forward, is they fear that things will only get worse if they say something. So a lot of kids say, I don't want to be a snitch and I don't want to make things worse, so they suffer in silence. So that's a big important part of that policy. Additionally, we can't ignore the kids who are acting out and bothering others. Part of those safety plans or the conduct plan for the aggressor involve weekly check-ins and the building of rapport. And often there are restrictions put on the aggressor that are lifted over time as they demonstrate that they can handle themselves more appropriately. That tier 2 for targeted interventions That's actually shared by school counselors, social workers, and school psychologists. School counselors are working really with, again, the kids who come up from tier 1, and the school social workers and psychologists are typically working with kids on an IEP in special ed who have social emotional goals in their IEP. The kids who still need even more wind up in the tier 3 zone. And that's where you're going to have a very small number of kids needing very intensive interventions from social workers, school psychologists, the alternative learning program, sometimes outplacement and residential programs. And just like when you start undermining a foundation and you start whittling away at that tier 1, those problems don't go away. They merely shift or they go underground. And you wind up getting problems that are falling on the shoulders of people who don't feel either prepared or equipped, like teachers, to handle some of these issues, or they're impacting the school social workers and the school psychologists. And it's not that any of one of those roles is more important than another. We all serve a purpose in very different but interconnected ways. And that's it really for that slide. We can go to the next one.
I believe Mrs. Hennessy-Liptrot was going to speak to this slide. I don't know if she's on the call.
You can just raise her hand. I will find her.
Okay. If you'd like, I can speak to the slide if she's not available.
No, she's coming in now.
Oh, great. Thank you.
Hello. Hello. Sorry for the delay. I was muted. I keep doing that. Oh dear. So this is just some data we wanted to share with you. It shows students that experience depression, anxiety, and behavior disorders by age. And you can see in the first bar graph that students ages 6 through 11, about 2% experience depression. Ages 12 through 17, it's 6%. For anxiety, students ages 6 through 11, it's about 6%, and ages 12 through 17, it's over 10%. And for behavior disorders, ages 6 through 11, it's 9%, and ages 12 through 17, it's almost 8%. And this data is prior to COVID. And recently, our Commissioner of Education, Angelica Infante Green, stated that, this is a quote, "The compounded impacts of COVID-19 have had a devastating effect on student academic and social emotional outcomes across our state and across our nation." So as school counselors, we want to help these students, but we're very concerned with the decreased staff that we have being able to meet the needs of the students. The next slide, please.
As school counselors, our professional organization is the American School Counselor Association, and the ideal caseload is 250 to 1. You see that in the square. However, to the left, the high school's caseload is 294, the middle school is 363, and the elementary levels, honestly, I don't even know how they do this. This is more than double the national average for caseloads. And you see the numbers there, 683, 632, and 763. But the reality is, even if you just take McCord as an example, if a student comes to me in distress and they happen to be on Mrs. Carlson's caseload, I do not say, "I'm sorry, you know, it's Thursday, she's not back until Tuesday, you can come back and have your crisis then." Of course not. So essentially, there are days when it's just me and essentially 500 students, whoever needs help, whether they be distance learning, coming in person on their off-person days, or they're in person. They're all our kids. And sometimes when a student is ready to talk, needs to talk, it needs to happen then. Or it can be a missed opportunity. These are children we're talking about, and sometimes they can be, as you know, as parents, kind of dramatic. And if you shut them down and say, "I'm sorry, I can't," they just walk away, and you may lose that opportunity. Next slide. This slide is heavy with data, and I'm not going to read it all. So really the takeaway, this comes from the American School Counselor Association. The bottom line is, this is data about the recommended ratios. For when you have the appropriate ratios, it's linked to better attendance, higher SAT scores, math, verbal, and writing. Having school counselors at the elementary is linked to higher graduation rates. In Connecticut, the higher performing schools had much lower caseloads, and then the low performing schools had much higher caseloads. So the data is clear. The ratios matter. Next slide, please.
Mr. Chandler, one of our elementary counselors is going to present this section. I believe it's Mrs. Smith. Okay, unmuted. Hi, everyone. Hi, sorry. Okay, so I can see, great. So hi, everyone. It's Mrs. Snell here. I'm at community school, and I'm going to present a lot of what our middle school friends just said. Amazing. Oh my God, I'm saying friends, like so elementary right now. So as you can see, our ASCA national model was just brought up, and I'm going to not take a lot of time, much more of your time, but elementary school counselors are stakeholders sitting on the teams that support our students, school improvement team, target team, RTI team, where we work with our colleagues. We analyze the data to implement school-wide programs and provide specific group and individual supports. Next slide. Awesome. So the importance of SEL, social emotional learning. Why is social emotional learning important? Decades of research studies demonstrate the following benefits of SEL, and you can see them here. I'll just mention a few. Sets the foundation and provides long-term benefits well into adulthood. Improvement in students' social and emotional skills, attitudes, relationships, academic performance, and perceptions of classroom and school climate. Decline in students' anxiety, which we're seeing a lot of right now, behavior problems and substance abuse. We were seeing that well before this too, but as the pandemic is definitely taking a toll on our students. And long-term improvements in student skills, attitudes, pro-social behavior, and academic performance. Next slide. So here's a quote from a fellow counselor that we feel captures why we are needed now and how important our roles will be when schools fully reopen. And like I said, when we see what the toll has taken, this toll that it's taken, we were important before. I think we're even more important now. But SEL supports learning by giving students and staff the skills and tools to better manage emotions in and out of the classroom. School counselors can lead the way in creating a culture where SEL is central in all classes and throughout the entire school building. The benefits of SEL will help support students and staff through the coronavirus pandemic and beyond. While we still have a great deal of uncertainty ahead, it is important to recognize the importance of this work, and building these skills right now might be one of our most critical next steps. I mean, I could speak to this much more, but Mike, you can go to the next slide. I think we're getting the gist, and we know kind of what we're facing. Even with the uncertainty, we know it's going to be, we're going to need all hands on deck. Next slide. Screen's acting weird. Okay, so the ratios did come up earlier. You can see our elementary ratios are wild. Mrs. Gauthier with 2 schools is 683 to 1. Mrs. Snell, I am the full-time counselor at Community, as some of you know. And thank you for listening to our presentation, but I am 632 to 1 at the moment. And Mrs. Smith now has 2 schools, and she is 763, including the preschool, to 1. So we're still way higher than the average, which is 214, and higher than the recommended ASCA student counselor ratio of 250. So those numbers are an eye opener as to what's going on in our district. Thanks. Next slide. All right. So we're just going to give a little, like I said, not going to take, I know, I'm so conscious of the time. So full-time counselor. So like I said, lucky, blessed, feel great that I'm a full-time counselor, and Community is a huge school. So we have that. But we're going to go back and forth, Jill and I. So
Visiting every classroom. This is what we do once a month. Right now, COVID has definitely thrown a wrench in some of that. We're doing everything online and virtually through our Google Classrooms. However, once we're back in, we'll be back in the classroom. So visiting every classroom, K-5, once a month, implementing the SEL curriculum, teaching students skills to cope, regulate their emotions, and resolve conflict on their own. And then part-time, Jill. Does Jill have her hand raised? Because I can read her part.
Yes, she's in.
Okay.
Hi, I'm Jillian Smith. I am currently at Ashton on Tuesday, Wednesdays, and Cumberland Hill on Thursday, Fridays, and alternate Mondays. And some of the part-time counseling responsibilities, you've seen the full-time. We visit K-5 classrooms half the time, so we do bi-monthly lessons for a total of 5 lessons. We implement the district's attendance policy with fidelity at 2 schools, so we're doing this double the time. We're also the 504 coordinators, scheduling meetings and writing the plans for 2 schools. And we do the Aspen scheduling and do the TCS data, which is the switching of interventionists and students that are serviced by case managers in special education as well. Next slide, please, Mike.
Okay. So yeah, thanks. So again, we're just going to go back and forth real quick. So at my school, we are RICAS, like that is what we do. We are the test coordinator. I'm sure middle school can speak to that too. High school will speak later, but RICAS and NGSA. And I know that part-time is really a struggle. So Jill, you can take that part.
Okay, so we're going to serve as test coordinator for RICAS and NGSA at 2 schools. So some of the things that have we've had to lessen is we can no longer fully take on NAEP or survey works. I had the STEM teacher did a lot of that for me this year. Thank you, Monique. And social skills groups, because we are there half the time at the schools, we are servicing fewer students. We'll show you specific numbers later on in the presentation. Individual counseling, we're also servicing fewer students due to not being in the building every day. And check-in, check-out, and also Swiss data entry, which is one of our tier 2 interventions. We cannot do this due to not being in the building consistently. So that additional task is falling upon the classroom teacher, who have so much other things going on right now that it's a real shame that that's had to fall upon them as well. Next slide, please.
Well, the chair, yeah, we talked about the different teams that we're on and how you guys have had to taper that too. All right, so slide 15.
Okay, I got this one, Lauren.
Yep.
So as part-time counselors, we feel like we're being asked to do the impossible. We are asked to split ourselves between 2 schools, double the student population, and maintain the same duties, or try to, at 2 buildings. We are being asked to do this during a global pandemic where everything is uncertain. There's still the same amount of time in a school day, and thus the aspects of our job that are falling through the cracks include those that are listed here. That's less student connections or FaceTime with students and having to choose between servicing students or attending meetings at other schools, less classroom guidance lessons, less time for students' observation and target team interventions, less time to communicate and coordinate services with teachers and other mental health providers and parents and guardians, less time to do projects to build school climate and culture, such as check and check out, assemblies, bulletin boards, morning announcements, etc. And a lot of times I was speaking with social worker and school psychologist, it's duplicating the responsibilities between the 3 roles because we're having to kind of pick up the pieces for each other when we're not in those buildings. Next slide, please. This is just some.
Oh, are you doing some 16?
Oh, this is you.
Yeah. So why elementary counseling? And I really think middle school touched on this pretty much awesomely, but I'll read them really quick. 25% students will witness or experience a traumatic event by age 4. 67% of students will witness or experience a traumatic event by age 16. And then 1 in 5 youth in US will experience a mental health disorder at some point in their life. 8.3% of youth will be diagnosed with anxiety, like we had mentioned before too. One of the most common mental health disorders that occurs in youth today. I guarantee everyone has experienced whether their own or someone else's anxiety, especially during this pandemic. And the median age of onset anxiety disorder is age 6. For ADHD and behavior disorders, age 11, and all mood disorders, age 13. So there's definitely some statistics there that can show why elementary counseling is so important and why we've had it in the past, and we've come back to say this needs to get back put in our schools. I could say a lot more, but I'm going to keep it rolling. So Jill, why don't you take next? 17.
Okay, so we wanted to break this down for you in terms of numbers. So what we did was we took the full-time service, and this is BF Norton. So BF Norton, when I was at BF Norton previously as a full-time counselor, for halfway through the year, I would see 409 students. Now that I'm at Ashton, I don't know if you guys can see it, but halfway through the year, I've serviced 190 students. And at Cumberland Hill, I've serviced 161 students. And next slide, please. This is Mrs. Gauthier, who is now, she was full-time at Garvin, and now she's part-time at Garvin and BF. So for a full-time counselor, she serviced 411 students at this point halfway through the year. Now at Garvin part-time, she serviced 180, and at BF Norton part-time, she serviced 138. Next slide, please. So this data shows that 56 fewer students have been serviced at Garvin. So that's 231 students this current school year, and 66% fewer students were serviced at BF Norton, or 219 students, due to the cut of the full-time counselor. And unfortunately, we did not have data from Ashton and Cumberland Hill because of cuts to the district. There was movement, and one is no longer employed with the district. Next slide, please. I just want to say before I touch upon these quotes that we've taken some steps back from the great steps we have worked so hard on taking forward in our implementation of mental health in elementary schools, especially when there's so much uncertainty in the world today. We as a district want to you to please reconsider putting elementary counselors back into the buildings full time. We want to be there for our students and continue supporting them to our fullest potential, giving them 100% 5 days a week like they deserve. And we also worry about our teachers. When students become dysregulated and we're not in the building that day to be able to take them, academics are also being put on hold while the classroom teachers have to process with the individual students, and thus taking time away from classroom instruction. So these are just some quotes from some faculty that I kind of said, you know, how do you feel impacted by the cuts? And one said they noticed the absence of morning announcements and mindful moments, which I would do every day. I know they are virtual, but having one consistent person available to do this each day helps build community and communication and positive, healthy attitudes and practices. And the next one is from a first grade teacher who I thought like hit the nail on the head. She said, as a classroom teacher, I would like to be able to meet the social and emotional needs of each and every one of my students. However, the demands of the classroom do not allow for such supports to be given properly. Therefore, the need for a full-time school counselor at each elementary school is imperative to meet the needs of our students. Given our current situation, many students are struggling. We speak so much about the importance of bringing students back for their social emotional well-being. However, how can this be brought back ethically if proper support personnel aren't there to meet those needs? Next slide, please.
Thanks for listening to our portion of the school counseling presentation. Jill, myself, and Kim. I wanted to just finish by reading you a little quote from a third grader in our school district. You can always make me smile. You can always cheer everyone up, even the saddest person in the world. I want to say thank you for helping everyone in the whole school learn how to be happy, not sad, in a way they can. I hope you realize how much of a difference you're making in the world. I'm really inspired by you and want to be just like you when I grow up. I'm very grateful that I'm able to talk to you when I'm feeling emotional. I really appreciate your effort you put into everything and everything that you do. Third grader, guys. So thank you.
Thank you.
So we wanted to give you a little bit of information about what middle school counselors do. So like our elementary partners and high school partners, we have many roles. We provide advocacy, comfort, understanding, validation. We try to identify our students' academic, career, and social emotional needs, and we have programming in place to meet those needs. We frequently work with other professionals in the school to provide interventions that help remove the barriers to academic success. We also help students develop skills and behaviors that are school appropriate and again lead to academic achievement. Middle school is a time where students quite often have difficulty managing their emotions. It's a time of great change. We teach lessons on emotional regulation. We also work with students to teach them the skills necessary to have successful relationships with others. These skills, attitudes, and the knowledge we provide is really the foundation that these students need to move on to their high school years. And it's really critical that we have adequate staffing so that we can make sure that we are able to get to all of the parts of the comprehensive school program that are so important. Next slide, please. So to accomplish this, we do a variety of things, building connections with students and families. Any educator that has experience will tell you that this is so critical. Without connections, there is no learning. As I mentioned, we teach a variety of types of lessons. We work with students on academic planning and goal setting. This year, we are implementing the Individualized Learning Plan, which is a mandate from the Rhode Island Department of Education. The district has generously purchased a web-based platform called Naviance to support this work. But it is time-consuming work, but we're hoping that what it will lead to are better academic and career outcomes for our students. We work with students on an individual and group basis. Some of the groups that we run involve social skills. We have groups that work on inclusivity and school culture. We work with students on wellness and friendship groups. We frequently do peer mediations. It is difficult sometimes to navigate disagreement and conflict with peers, and we want to make sure that our students are taught to do that in a respectful manner. Like Mrs. Snell and Mrs. Smith mentioned, we are also part of the teams at our school, the target team and support team that analyze data and work to put interventions in place to support our students. We also spend a great deal of time working with other stakeholders, parents, teachers, administrators, the other mental health professionals, and also outside providers. Next slide, please. We also do some things that take quite a bit of time at certain times of the year. For example, transition planning and support and scheduling. Right now, we're working with our 8th graders to help them make their course selections for high school. We work on transitioning our 6th graders from 5th to 6th. We spend quite a bit of time over the summer scheduling. And unfortunately, that has become challenging as well because the number of days that we work has been cut. And what ends up happening is the work is still there and we end up spending a significant amount of time outside of our day trying to accomplish what needs to be accomplished so our students don't suffer. We advocate at meetings for our students. We are in charge of standardized testing at our buildings. We support our homeless families and we spend some time trying to make sure that students' basic needs are met, including holiday help. Next slide, please.
So piggybacking off of talking about issues of homelessness, here's Maslow's hierarchy of needs, which I'm sure you're most likely very familiar with. At the bottom, at the base, are our very most basic needs, like breathing, eating, and sleeping. And up from there, safety in terms of home, having a bed to sleep in, and access to being able to be clean. The assumption is that kids come to school ready to learn, that they are fed, they feel safe, and their basic needs are being met. But the reality is we have so many families in distress now more than ever due to COVID. But also we've had them for years in the past. We have struggled with homelessness. We've had students living, and we do now even have them in motels, campgrounds, doubled and tripled up with relatives, couch hopping. We have one student who moved 7 times in 7th grade. And the example is of a girl crying in class. And this happened a few years ago. And instead of the teacher trying to manage it, because we had 2 full-time counselors at the time, she sent the girl to me. She told me that she was upset that her older sister was going to get in trouble at the high school. It's the kind of thing that you might just say, oh, she'll be fine. And the problem was that her sister wouldn't have her art supplies on time and was going to get in trouble. So on the surface of this, it looks like a very simple, solvable problem. Oh, you don't worry, your sister will get her supplies, she'll be fine. But I wound up, because I had the time, because I'm not teaching 25 students, I learned that the girl didn't have art supplies and that there was a big blow up at home. And so I wound up calling the father, and he tearfully explained to me that there had been a recent disability, a loss of job, and he was having trouble putting food on the table for his 2 girls. It took a lot of courage for him to say that to me. There was no money for art supplies. And so as happens, I'm sure, at all the schools, More Court rallied, we passed the hat, we do dress down funds. We got this family connected to the Happy Basket program, which provided an immediate help in terms of basic groceries. But we also connected them to outside resources for long-term help. I'd like you to think about that example when you hear about what teachers are saying in terms of how they are being asked now to handle the social emotional issues in their classrooms, and they feel ill-equipped. Because if this girl had just been patted on the head and said, she'll figure it out, honey, here's a tissue, go back and let's get back to schoolwork, because I may be in a meeting or I'm meeting with another student and I'm unavailable and Mrs. Carlson isn't there. So I think this helps to show that the school counseling job, like any counseling relationship, depends on developing a rapport. And the lessons are our foundation of that. It's important for kids to see us and get to know us when they are not in distress, when they are in classrooms and we're just giving lessons and it's a relaxed feeling. School counselors have a unique position. We are not grading those students, we're not giving grades, and we are not ever disciplining either. Our position is neutral and it's special and unique. And we work hard to build a trusting relationship so that students will feel comfortable when they need to share private, often painful situations and feelings. One girl in particular that I'm working with right now, it has taken her 3 years to trust me enough to open up. And she's someone that I have very serious concerns about. And I'm grateful that I've had the opportunity to work so closely with her and to build that rapport. I have to say personally that in order to do the job, which at times feels undoable, I, like many of my colleagues and like many teachers, working well beyond the school day hours. And people say, oh, just leave it for tomorrow, it'll be there. But that's a phone call, that's a parent, that's an email, that's a schedule that didn't get changed. These problems don't go away and they just build up. And I'll tell you, it's taking a toll. Next slide, please.
So we all are familiar with the data about COVID and how the impact that it's having on our students. And I won't read this list to you because I know that our presentation is quite lengthy and you can read this for yourselves. But what we're anticipating is an increased need for school-based social and emotional health support, And we expect that many of our children will end up having a trauma response to what they've experienced over the last year or more. And that is going to require more support, not less. So again, we want to make you aware of our roles and we want you to have this information so that when you are making those very difficult staffing decisions, you consider this. One thing that I find shocking, and I think you will as well, is in the last year, 7 McCourt students have experienced the death of a parent, not due to COVID. Not all of them are due to COVID. However, the impact that has on a child and their family and their ability to learn is very significant. And it requires an incredible amount of support from all stakeholders at the school. And we definitely cannot provide that kind of support to our students when we don't have adequate staffing. Next slide, please. So I think some people may think that during COVID, we're not as busy, but we are even busier. And here we've listed some of the things that we've done. So we do a lot of outreach to students and families. Unfortunately, with COVID, we've had some students that have had difficulty with attendance and completing work. Many parents have found it challenging to manage the online school day. We even try to troubleshoot with technology, which that's a real challenge for us as well. But we do what we can to support students in this new learning environment. So we just want you to know that even though things look very different, we're still trying to achieve the same goals and outcomes. Next slide, please. Again, there's quite a bit of data about children's mental health. I'm not going to read this as well, but it is necessary when kids return to school to, if not bring back the past staffing levels, but to maybe even consider increasing them because we do expect that the need will be great. Next slide, please.
So what parents have to say, we had a number of parents reached out and told us the impact that school counselors have had with their children. We had actually highlighted pieces here, and I'm not exactly sure why the highlights aren't showing, but one parent said the school helped her daughter through difficulties of divorce and alcoholism, supported her with anxiety issues, turned out that the child also had a learning disorder. Now she's a sophomore in high school, and the mother feels that much of her success was because of her, the support she received during her middle school years. Another parent wrote, I can attest to having the value of staff available to support children. My youngest child is currently a 7th grader. During his 6th grade year, he experienced some mental health challenges and was supported a great deal by his school counselor. They developed a bond that helped him feel comfortable reaching out for help when he truly needed it. The counselor went above and beyond her level of support for my son and the whole family, even visiting him during a hospitalization and checking in throughout his time away at school. Another one, I truly feel that both my child and I would have felt overwhelmed and defeated without the support of the school counselor. Please understand that we work with families too, not just children. I feel at ease knowing that there's someone at my school every day who knows my child and will provide the support she needs. Middle school, if you can recall your middle school years, you all know it can be one of the most difficult times in life, the time with many emotional, social, and physical changes are happening. These young people need all the support possible as they navigate critical development. My family's been fortunate to have the support of the school counselors over the years. Next slide, please. Good, this one's highlighted. So we did take a survey. 100% of the teachers responded that the impact of losing school counselors has made it harder to share information and harder to get help and support for kids. We also allowed teachers to write what the impact was like and describe it for both the impact on them and the impact on their teaching and the impact on their students. One teacher, I'll read just the highlighted parts. Fewer opportunities to build relationships and connections with their counselors. Sadly, students are not reaching out as much, even though we know the data has just shown through this presentation, the need is greater. And the families do have great needs. It's impacting the school nurse. She writes, if a student is in need of a counselor and one counselor is not available, maybe because she's with another student or a meeting or teaching a class, the student will often go into her office, which gives me concerns about COVID. And her office is also very busy. And often she does not have the time to work with that student who needs a counselor. Teachers, the last quote there, the teachers now have to stop teaching to address emotional issues that last year they didn't have to do. Next slide. Teachers had a lot to say. There's not enough support for students that need it. A general educator wrote, trying to support students' mental health with the classroom not only impacts the class academically, but their own mental health. I've had more than one teacher break down in my office, and we've had teachers leave. This is an extremely challenging year, and I think the years to come are also going to be difficult. Students are struggling this year more than ever. Oh, sorry, I skipped one. I cannot provide the supports like our school counselors can. We need them. Special educator wrote, the reduction of school counselors has made it challenging to collaboratively develop plans and strategically approach situations to best meet the needs of students. This is again like the idea of that of the school counseling responsibilities shifting to others, and they're already overworked. This person is in administrative role, writes that I work with every student in the school. The impact on my position as an educator has been the need for me to take on some of the roles traditionally done by school counseling. Next slide. The workload is overwhelming. It's not enough support for our students and families. Students are less able to connect with one counselor as they see different counselors on different days. Sometimes kids don't want to open up to one person in particular. They have a rapport with someone else, and that needs to be respected. It's become even more challenging to meet the needs of our students and families. School counselors who are helping are overwhelmed and overloaded with students and work. Students are falling through the cracks. It's completely unacceptable. We are all trying our best, but it just isn't enough. They are not able to form a relationship with their counselor because one day out another day. Okay. Yeah, you can read the rest. Next. And if I may, these are the only 2 quotes we have from students. When I was going through a very difficult depression, both school counselors were there for me. I was so down, I started cutting. They helped me through it. I'm very fidgety, and sometimes I have panic attacks and need breaks. They talk to me and they help me find coping mechanisms and give me tips on how to talk to my family. Both counselors are very supportive of me and really helped me to understand what I was feeling and how to talk to my parents. Middle school is a time for change, and when students are starting to figure themselves out, some students may not feel comfortable talking to family members or friends and may need someone there for them. That was a high school student reflecting on their middle school years. Thank you.
Ms. Butler is going to present the next section, and she said it's 11 minutes.
She should be coming in now.
Hello? Can everybody hear me? Thumbs up?
Yep.
Okay. Sorry, my whole screen just changed. I have a double screen here and the whole thing just changed. So now I'm kind of freaking out about that. So my name is Julie Butler and I'm one of the high school counselors along with Tracy Ewick, Michelle Fournier, Jim Connor, and Denise Kimball. And together we've had over 17 years of experience in high school counseling and we've seen such a dramatic change in the support and school counseling at the high school level. Next slide, please. In addition to everything you just heard from our elementary and school counselors, high school counselors have added responsibilities pertaining to the 3 domains of academics, college and career planning, and social emotional issues. For academics at the high school level, the stakes are a bit higher because at this level, students are retained and in some cases may not graduate. So it's imperative that we monitor students who are failing. This means tracking their failures, sending out progress reports, informing parents, and meeting with the students individually. Additionally, we need to keep track of every class for every student through the use of transcript reviews and credit audits, which I'll talk about in a few minutes. College and career planning is also much of the focus of school counselors at the high school level. We have to meet both in groups and individually with every student to discuss their post-secondary plans. We need to fill out the common application for every student that applies to a 4-year college. We need to write letters of recommendation. And now with the new purchase of Navient, we need to learn an entire new program practically on our own since we have been offered limited training in Navient. It's not a secret that mental health issues among teens is at an all-time high. We've seen a dramatic increase in students being hospitalized due to anxiety and depression and having suicidal thoughts. This means having to collaborate with outside mental health providers in addition to collaborating with our own mental health staff. And what about the students who can't afford outside counseling? They go to our school social worker and school psychologists who are also overwhelmed with the number of students in need of mental health. And therefore, those students come to us for their mental health needs. And believe me, the need is great. Next slide, please. High school counselors have historically worked 10 additional days, 5 days after the teachers leave and 5 before they return. I'm not talking about the 6.75 contractual days either. Every single person in our department works well beyond our contractual days every day. It's just the nature of the job. In order to be able to meet the constant needs of our students, parents, faculty, and administration, we have no choice. Anytime you come into the guidance office after school, I guarantee you some of us will be there till 4, 5, 6, 7 o'clock at night sometimes. Excuse me. But this much needed time of these 10 additional days has been cut in half to 5 days. So I wanted to figure out how much we're actually working. So I figured it out, and it wasn't surprising to me to discover that we're actually working 18 days to fulfill our duties, never mind the 10 days we used to have. And those days include nights and weekends prior to the start of the year, so students will have their schedules on time. Given all the effort we put in to make day one go smoothly as possible, to have our days cut to 5 is more than disheartening. The pathway programs have been an exciting addition to our school, and on the plus side, has generated over $600,000 in revenue for our school district. However, these programs and the additional students who participate in them have pushed our class sizes to capacity, leaving little room for our students to take classes they've selected. We should be taking that revenue and reinvesting it by hiring additional teachers and counselors at the high school level to support the influx of students coming from different districts. This year, the schedule was so tight, it took us twice as long to schedule students because the courses were not available, because we didn't have enough staff to add additional sections or courses of subject areas. Our administration got creative and added a clipper block to ease the stress for some students. And the clipper block allowed students who didn't need all 7 classes an opportunity to take a break during the day, which is great. But the fact is, if we use the generated money to hire more teachers, we wouldn't need to offer a clipper block. Next slide, please. In June, after the teachers leave, the counselors are waiting for the failure report to be generated. From there, we're sending out failure letters to parents and students to get them ready for summer school. They have to know how they need to register. We need to send out the registration information. Additionally, we're beginning the process of completing credit audits. Credit audits involve inputting classes that each student has taken, reviewing whether service learning was completed, whether they have fulfilled the PSAT or SAT requirement, whether they completed the financial literacy requirement, and with a caseload of 294 students times approximately 10 minutes per credit audit, we're talking about 49 hours worth of work just to do our credit audits. That's 7 days just to do credit audits. Next slide, please. And when we come back in August, we hit the ground running. The actual contractual time that we were paid this year was 3 days instead of the 5 we historically received. However, the actual amount of time we spent averaged 69 hours, or 7 days of nights and weekends to get the schedules ready for day 1. When we come back, most overwhelming can be email. If gone unchecked over the summer, we could have up to 600 emails. Therefore, all of us, everyone in our department, check our email on our summer vacation, because if we didn't, it would take a week just to get through the emails. The problem is each email requires us to do something. We need to change a schedule, inquire about a 504, request for a special ed referral, special ed programs to change schedules. And then there are parent phone calls. Historically, we also get 4 new students each, but with the addition of the pathways, even more new students are entering the district. Just 1 new student can take up half of our day between explaining our school policies, figuring out the right placement for a student, and giving them a tour of the school. Next, we are given a list of students who attended summer school, and we're back to reviewing transcripts and schedules in order to make sure our students are placed in the right level of classes. And finally, we are fixing holes with schedules which require hand scheduling each student. And it's like putting a puzzle together because classes conflicting with one another and trying to figure out classes based on their primary selections and their alternates. The average time just to hand schedule 1 student is approximately 10 to 20 minutes, depending on their needs. Next slide, please. You can see from this slide that our ongoing responsibilities are numerous. We wear many hats, from monitoring academic success to helping students plan for their future, to being a listening ear to students who suffer with severe anxiety and depression. Next slide, please. But in addition to those ongoing responsibilities, we also have a school counseling curriculum that we must follow. And that can be challenging given our increased caseloads from 250 students to almost 300 students. You wouldn't think it's a big deal, but each student is time spent. From August to December, we're meeting with 9th and 12th graders. The seniors take up the majority of our time. The college application process is extremely time consuming between filling out the Common App, writing letters of recommendation, and meeting with each individual senior to go over their future plans. As you can see from this slide, we have a responsibility to our seniors while at the same time continuing to do all of our ongoing responsibilities. It's a lot. Next slide, please. Our goals in January through April are to meet with 10th and 11th graders and also beginning the scheduling process. Like the seniors, the juniors are beginning their post-secondary plans, so those meetings tend to run 30 to 45 minutes per student as well. So we are also in the throes of planning the career fair, which is a huge job to coordinate. And scholarships are also a huge time consumer, as each scholarship has to be vetted before it can be advertised. And again, we continue with our ongoing responsibilities. Next slide, please. April to June, we're focused on our seniors in danger of not graduating. This is intense as we need to constantly monitor them to make sure they're meeting graduation requirements. In addition, we're responsible for AP testing, which can take up to 3 weeks of our time proctoring exams. Next slide, please. When I started in guidance 17 years ago, we had 3 secretaries, and now we have 1. We had 6 counselors, one of which was a department chair with a caseload of 100. We were also understaffed and had a caseload of 275 back then, but having a department chair helped because that person organized our presentations, did the master scheduling, helped to develop our curriculum, and worked collaboratively with administration, and had a caseload. Now our department chair is an administrator, having to wear 2 hats. One is vice principal of teaching and learning, and 2 as our department chair. He also doesn't hold a caseload. It's not fair to him, and it's not fair to us. We need a leader in our department who does what we do, just like every other department in our high school has a content leader. Back then, we also had a budget and were given necessary supplies. We are not even given adequate supplies to do our job. During COVID, we needed cameras and microphones for our desktop computers to do Google meetings, but we weren't provided with them. Chromebooks are 12 years old and out of date. Each classroom in the high school has a presentation screen and an overhead projector, except for guidance. Most teachers have hover cams, not guidance. Some of us purchase our own computers, cameras, even file folders and labels. Final slide, please. The bottom line is, given our enormous responsibilities to meet the growing needs of our student population, all counselors and additional counseling days at every level need to be restored, including a department chair at the high school. Thank you for your time and consideration of this important matter.
Mrs. Carlson, is that the end of the presentation?
That's the end of the presentation.
Okay.
Madam Chair, yes.
Okay. Well, thank you everyone for taking the time to give us a very good overview of the work that you do, the challenges that you face, and at every level. And I think, we can all agree that, what we hear about the mental health challenges and the increase in it during COVID is certainly, I think, something that's on everyone's minds. So I guess I would, we can have an opportunity here if there are any members of the school committee who want to comment or ask any questions. It was a very thorough presentation, so I understand if you, and can that presentation be made available to us too?
Absolutely, we would be happy to share it with you.
Okay, great, that would be great. Mrs. Feather?
Yep, thanks. I was going to ask the same question about, first of all, about if it could be available. So thank you very much. And thank you so much for the comprehensive presentation. One thing I just wanted to, I wanted to thank you guys because I have 3 children in the district, and each one of them has benefited from using the services of school counselors. So I know that they're definitely that you guys do a lot of great work. So thank you.
Thank you so much.
Ms. Smith?
Oh, yes, thank you. I just wanted to say the same. Very, very thorough presentation and information. It is something that all of us on the school committee have been watching, and we have been reading your emails and looking forward to getting this presentation. So I just want to say thank you. And then for the school committee members, I believe that Ms. Shabbat had put that in our new business folder already.
Okay.
So it was put in there during one of our earlier meetings.
Okay, great. Thank you for that. Okay, yeah, so thank you to the entire staff who presented tonight. I know last year we had some, difficult budget decisions to make. And I think this year, as we think about the impact of COVID on our students, not just academically, but emotionally, we have to really be thinking about what we can do about that. So that was very, very helpful. Okay, any other comments? All right. Thank you, everyone.
Thanks so much for listening.
The next couple of items on the agenda, I think actually fall under Mr. DeMonica's domain. Mr. DeMonica, would you like to take these? Oh, you're muted. I don't know if you're talking.
All right, here we go. I'm sorry. All right, so the first one we have tonight is approval to award the abatement testing and analytical services for the following projects. One is at the Cumberland High School. The second is at the J.J. McLaughlin Cumberland Hill School. Now, we got a letter sent over on February 9th from Colliers International that they went out to bid for these two items for the $79 million bond. They are recommending that we hire Emory Environmental Associates at the amount of $10,450. And Colliers will maintain the oversight for these two projects. And the funding will be coming from the $79 million bond proceeds. So we'll vote on this. The building committee will vote if they haven't voted already, and then it goes to the town council as well. So it did pass on a 3-0 vote, and I would move passage.
And so Mr. DeMonica makes a motion to approve the awarding of abatement testing and analytical services for the projects at Cumberland High School and Cumberland Hill Elementary School. Do we have a second?
I will second.
Mrs. Smith seconds. All in favor?
Aye.
Aye. The ayes have it 7-0.
Great. Next is discussion and a vote to approve SCPR 02-2021-04, the E-rate wireless projects. And what this is an amount payable to Hub Technical Services of $156,410.66. The school district will receive from the E-funding, which is on everyone's cable bills, et cetera, in the amount of $57,272.92, leaving the school district responsible for $99,137.74 after the E-rate reimbursement. It did pass on a 3-0 vote. Ms. Smith asked us that if we could, the money's coming from the technology budget, but she would like to see it broken down even further of how the money is allocated from the technology budget, and then I'll see why we can't resolve that. So they'll get that into the file for the next time we meet so we can see the update, but it did pass on a 3-0 vote to award to Hub Technical Services. I would move passage.
And Mr. DeMonica makes a motion second by Mrs. Rogalski. All right, perfect. All in favor?
Aye. Aye.
Aye. The ayes have it 7-0.
Okay, next is discussion and a vote to approve the payment of bills The business office invoices were $2,925,809.15. The Fiscal Finance Subcommittee only approved $2,068,103.23. We did vote to hold back payment of an invoice from Blackstone Valley Prep in the amount of $857,705.92, seeking additional information regarding the COVID PP money that they had gotten from the federal government, and we had concerns about that and how that affects our budget requirements to the BVP. So we did have a discussion. Mr. Collins, brought up some valid facts about legal, so that we don't get in trouble. And it passed on a 3-0 vote, right, Mr. Collins? You voted yes?
Yes, that's correct.
Okay, I didn't make a note on my sheet. I'm sorry.
No. Now, after the discussion, we got it out there, but it's generally agreed that this is the right move.
Right. So I will make a motion to payment of bills of $2,068,103.23 and hold back the payment at this time to BVP for $857,705.92. I'll make that motion.
Okay, Mr. DeMonica makes a motion. Do we have a second?
I'll second motion.
Smith seconds it. All in favor?
Aye.
Anyone opposed? Mr. Fiorello? Nay. Okay, the ayes have it 6-1.
Thank you.
Thank you, Mr. DeMonica. The next item on the agenda is comments from the public. So you can raise your virtual hand in Zoom, or you can *6 if you're online. Mr. Chandler, do you see anyone?
Yes, we have Alyssa Poria.
Okay, and Alyssa, just state your name and your address. And there is a 3-minute limit. Mr. Fiorello keeps track.
All right. Alyssa Poirier, 209 Abbey Drive in Cumberland. I'm speaking tonight on behalf of Kim Gauthier, our school counselor at Garvin. My name is Alyssa Poirier, and I am a first grade teacher at Garvin Memorial. In addition to my job as an educator, I am currently enrolled in the school counseling program at Providence College to become an elementary school counselor. I will be interning with Kim next fall and spring, and I will be graduating with my master's degree in school counseling in May of 2022. I have been a first grade teacher at Garvin for 6 years now. I love my job as an educator and my students. During my career, I have observed a shift in the needs of my students, and it no longer has just become the support of academics, but also the support of their social emotional needs. I began asking myself, how can I successfully teach my students when many of them were struggling socially and emotionally? This is what led me to go back to school to become a school counselor in order to have a more significant impact on all of the needs of my students. Much of my learning and training in this field centers around how important it is to be proactive in meeting the social emotional needs of our students, beginning at the elementary school level. Middle school can be the most difficult transition for many of our students. Therefore, it is crucial that our students are learning to problem solve and to self-regulate their emotions and feelings as early as 5 and 6 years old. Many of our students come into kindergarten and first grade without these basic coping skills. Without Kim in our building full-time, she is not able to implement the school counseling curriculum and provide her monthly lessons in each of the classrooms. The school counseling curriculum is an essential part of schooling for elementary students to take part in, just as math and reading is. If students are only receiving this curriculum at the start of middle school, we are now being reactive to their needs instead of being proactive. As a future school counselor, I cannot express how discouraging it is to hear that our school district is continuing to cut counseling positions. If there is one thing I have learned, it is how critical it is to have full-time counselors in every single building, including elementary schools. Abraham Maslow's hierarchy demonstrates that basic needs must be met before children are able to focus on learning,
and we are providing a disservice to our students by taking counselors out of the elementary schools. It is not a matter of wanting a full-time counselor, it is a need. Because Kim is split between 2 schools, it makes it very difficult for her to meet the needs of her students when she is in the building, when she is not in the building enough to teach the curriculum and service her students on a daily basis. It would be a terrible mistake to continue to split Kim and other counselors between their students, and I ask you to reconsider this decision. Thank you for your time.
Thank you, Alyssa.
At this time, I don't see anyone else with their hands up.
Thank you, Mr. Chandler.
I'm sorry, somebody just popped up. Christine Medici.
Hey, Christine.
Christine?
Hi, can you hear me?
Yes.
Okay, great. My name is Christine Medici. I am the secretary at Ashton Elementary, and I live at 58 Knollcrest Drive here in Cumberland. I am going to read something that I wrote a couple of days ago, so when I say today, please know I am referring to a couple of days ago this week. I would like to share with you an example of what I am experiencing at Ashton due to a staffing shortage among our mental health staff, specifically school counselors and school psychologists. In our school, there is only one mental health professional in the building per day. This causes tremendous difficulty when one student is in crisis and the mental health professional is involved in a Google Meet with distance learning students or a meeting face-to-face with another hybrid student. Although this has happened on numerous occasions since I began in October, it occurred again today, and I thought I would share this unfortunate situation with you. We have a specific student who is facing significant challenges and often needs help getting through her days. Today was another one of those times from our school counselor. When there was no answer, she tried again and still got no answer. She called me in the office to ask where the teacher was. As I did not know, I texted her, hoping she had her phone with her. And when I didn't reach her that way, I went to her office. When I walked in her room, I found her on a Google Meet with other students. She said she would not be available for 15 minutes more, but would then assist the classroom teacher. The child was leaving early that day, so there were only a few minutes left for the counselor to meet with her, which was not enough to get to the root of the issue at hand before she was leaving. So the outcome was twofold. Our classroom teacher struggled with the student who needed more help than she could give at that time, and more importantly, the student went home without processing the issue at hand. As I said earlier, this is only one example of how one mental health professional in a building is not enough. There needs to be more than one so that when one child is suffering or struggling, they are not left without mental health assistance because someone else has essentially beaten them in line. Needless to say, COVID has brought many new challenges to the classroom and to families. Not only has the pandemic been the cause for new mental health issues to some, but certainly has exacerbated mental health issues for those who were already struggling. It's our duty to have staff available to these students, so to not make them feel that they are not important enough for anyone to help them. Thanks for listening.
Thank you, Christine. Mr. Chandler, do you see anyone else?
Not at this time.
Okay. Thank you. We'll move on to the next item on the agenda, which is the school committee comments, school liaison reports. If any school committee member wants to make any comments or anything, now you can. Ms. Smith?
Yes, thank you, Madam Chair. I just wanted to recognize Mrs. Vaughn, Mrs. Friedland, Mrs. Canassis down at the community school. First, to thank them for inviting all of us to their fundraiser and fun time for the students, the cake wars that have happened over the last couple of weeks. I know myself, I was able to watch both of them and had a granddaughter competing in one of those cake wars. And they did an excellent job putting it all together. There were over 100 teams, I believe, in total that did this all through Zoom. The presentation, the packaging of all the bags of goodies, the themes, they did an outstanding job. And I just wanted to recognize all of that team and say thank you for what you've done for the students.
Thank you. Mr. Collins.
Mrs. Smith stole my comment, and Mrs. Rogalski was probably going to say something too. We were watching it, but what I didn't know is that we should have asked them to save a cake because today is Mr. Demodica's birthday, and I want to wish him a happy birthday. And maybe next year during the cake wars we'll get them. And those cakes were good too; they were like really nice. So happy birthday, Paul, and anybody else's birthdays today.
My twins.
Yeah.
My twin brothers.
Oh, okay. All right. Well, happy birthday to him too.
Two of us. Thank you, everyone.
Happy birthday, Paul.
Thank you.
Any other comments?
No, I'm good.
I know this just came out this afternoon, and I'm sure we will address this at a future meeting, but I wanted to acknowledge Mrs. Chandler from McCourt Middle School, who received the Golden Apple Award today from Patrice Wood from News Channel 10. And Mrs. Chandler is an 8th grade special educator at NCMS. So that must have been an exciting day. I mean, at McCourt, not NCMS. That must have been an exciting day at McCourt. So congratulations, Mrs. Chandler, on that. Okay. Yeah, Mr. DeMonica?
Mr. Collins, my telephone is going off like crazy right now. Thank you.
Well, they should have texted you earlier. I was waiting. So, I mean, they were really your friends. They wouldn't have waited for me. So happy birthday.
Okay, the next item on the agenda is vote to go into executive session. Mr. Mitchell, do we have executive session tonight?
No, we do not, Madam Chair.
Okay, then the last item is adjournment. Do we have a motion to adjourn?
Motion to adjourn.
By Mrs. Rogalski, a second.
Second.
By Mr. Collins, all in favor?
Aye.
Aye.
Okay, the meeting is, the ayes have it, 7-0. Meeting is adjourned at 10:08 p.m. Thank you, everyone. Have a good
Remind
night.
you, everyone, tomorrow night, don't forget.
Yep.
6:15.
And happy birthday, Paul.
Thank you.